Good afternoon, everybody. Thank you for your patience and thank you for joining us for this afternoon's session. Over to our moderator, Sebastian Ziegler. Good afternoon.
Good afternoon. Thank you very much, Catherine. It's my pleasure to welcome you all for this webinar organized by NGIoT on e-health. We'd like to raise your attention to the fact that the webinar is recorded. So if there is no objection, we will record the session and try to give and make the results or the content of the discussions available to more persons, a larger audience. So it's my pleasure to introduce this webinar with talented and excellent speakers and experts from different who will bring complementary perspectives on e-health. As you know, e-health is a very important domain in the IoT, Edge, cloud domain, impacting different technologies, and which will have a tremendous impact for the years to come beyond the COVID-19, I think, which was an accelerator for the adoption of e-health. We have important challenges to address in the years to come, due not only to e-health for diseases, but also with an aging population. So quite a number of challenges that Europe has to address. It's my pleasure to introduce very briefly the speakers we will have during this webinar. So to start with Martin Brinskov, who is a coordinator of NGIoT, but also professor at Aarhus University and did come also actively engaged in the OISC community. We have the pleasure and honor to have with us Rolf Riemenschneider, which is the head of sector at IoT at the European Commission. And as you know, the IoT in the European Commission is embracing more and more the integration with cloud and edge computing. And we have, last but not least, Karolina Makiewicz from the European Connected Health Alliance, who will present some specific views on the e-health challenges and opportunities. She's the director of International Projects team. And we have also with us as future speakers, I would have the pleasure to be the moderator. My name is Sebastian Ziegler. I have the pleasure to be the director of Monday International and IoT partner, as well as president of the IoT Forum and IoT Lab. And we have with us John Soldatos, no need to introduce, or a brilliant promoter of open source solutions for IoT. So John Soldatos will be our discussant and will contribute to the interaction during this webinar. He is attached to Intrasoft. This session, as it was mentioned, will be entirely recorded and published in the NGIoT channels. All participants except speakers and moderators will be muted by default. If you are not a speaker, please turn off your video. Feel free to post your question in the Zoom chat. That would be a very efficient way to channel your question in order for us to pick them up and to address them. If you would like to speak, raise your hand and wait for the moderator to give you the floor. And if you have any technical issue, please contact the Zoom host on the chat or send us an email at info@ngiot.eu. That being said, let me now give the floor to Martin to introduce the webinar. Martin, you have the floor.
Thank you very much, Sebastian, and thanks to the co-organizers here, the Commission, that we can have this opportunity to have a deep dive on this theme, which is health and care in the context of IoT and edge computing. So what I will do here as coordinator of the NGIoT Coordination Support Action, responsible for the roadmap on IoT research, innovation and deployment to come later this year. I'll just give you a very brief context, not the policy context, you get that from Rolf, but on where we are and why we are organizing this thematic workshop, as it's called. It's because we've been working for quite some time, and I'll show you in a moment what we've been working on together with, a broad set of stakeholders reflecting on what is the state, what is the market, what is the situation in IoT and edge computing in general, and then how can we turn that into a roadmap and mobilize communities around that, and most explicitly, of course, how does this relate to the work programs that are already out. So this has been going on for 2.5 2.5 years, and we have a little bit of time left, as you can see, to deliver this roadmap with some stepping stones on the side. And then we will give on the baton to EU IoT, our sister coordination project, OpenDI, which are also involved in these areas, and to the work program to kicking. So to say today is really to look what are the specific situational concerns, opportunities when we talk about health and care in this. So the very broad and cross-cutting we've been covering since very long, and as some of you know, since quite some time. And just to say that, of course, the idea is to support the policies of the European Union and its citizens, including companies. So it's the triple baseline, the economy, it's the social part, and certainly the environmental. So very much also to support the Green Deal. I'm sure Rolf will mention the Digital Decade Compass, which has this target of 10,000 climate neutral edge nodes by the end of the decade. Okay, so we can discuss what is an edge node in the context of health and care. So just to say that it's so broad in terms of technology that of course it's embedded in a policy context. This also means that time-wise, it's very both of course focused on the research, so the early stages of technology and understanding the issues around the area, but it's also on innovation, which is much closer to the market, and it should contribute to the immediate deployment, which is in the market. So just to say, we cover the whole thing: research, innovation, and deployment. You can look on the event website and see some of the market analysis that's already been performed. And again, it's a continuing conversation. You can see the previous work that's been here. We will also put the slides up here on the event website after the event. And of course, we will share in the draft roadmap and the final roadmap the consolidated versions, not just from what, let's say, the group closely around NGIoT has found, but certainly, most importantly, how the different voices of stakeholders' priorities can be put into a converged context. So there are some trends. I don't want to go into the details. You probably all know them, but it's to see how these trends that we are here today, how they translate and look when we look at them from the health and care perspective. So that's it from my side, and back to you, Sebastian, and to the colleagues.
Thank you very much, Martin. Let me know without any more delay, give the floor to Rolf Riemenschneider, who will present the perspective of the European Commission, in particular the IoT unit of the European Commission. Rolf, you have the floor.
Thank you, Sebastian. I'd like to share my screen. Wait a second. All right, so it should come. All right, so you should be able to see it now.
We see it, thank you.
Excellent, good. Good afternoon, ladies and gentlemen. Thank you, Sebastian. Thank you, Martin, for the introduction. This morning we had a discussion about IoT, 5G, and energy. Now we talk about health and healthy living. So it's my pleasure to talk about that topic because looking at the crisis, I think there's never been a period where I can remember, that we talked so much about health issues, particularly also with COVID, the staying at home, monitoring at home, becoming more and more important. And there has been a boost, particularly for digital technologies, either IoT, adoption of mobile technologies, data technologies, and so on and so forth. And we assume that will continue. So actually looking at the different sectors of IoT, that not all sectors have the same speed of adoption of digital technologies, particularly not of IoT services. There are traditional sectors like energy, where it's really, really low at the moment, although, technologies are available. But the driving sectors are consumer IoT, mobile phones, as you all know, and wearables. And wearables is one of the key issues. You also got a proliferation during the COVID pandemic times. But still, 70% of IoT revenues are cloud-centric. So what does it mean? Cloud-centric means that all the data collected by your wearable devices, for the majority, move to sort of a cloud storage where they are analyzed, and then you get your app and you get a feedback. This said, that has some implications on keeping data sort of in a silo because it's on proprietary clouds. And secondly, it might have some issues related to privacy. But still said this, looking around your home, I think more and more sensors will accompany you in your daily life, will support you, not only for elderly people, but also for any age, particularly during COVID crisis, to know, what's going on with your body, what's going on in your daily life, to organize your daily life, and to help you in the different activities. Given the fact that we have more and more sensing on data, there's also an opportunity that you have medical devices authorized by medical institutions where you have telemedicine applications and you can support, immediately you get medical support from professional services. And then there's discussion about, how to share health data across different hospitals or different treatments or services or analysis. But still, the whole ecosystem, what you see over here, is for a large extent based on sensing and feedback of a large amount of data, so far for the majority stored in central places. So why is edge computing gaining momentum? As said, we have more and more connected objects. We have more performance of mobile technologies, also with the introduction of 5G. There will be more and more sophisticated human interactions, augmented reality, virtual reality, more video, more cameras, more video interactions, AI, which are demanding high amount of data, analytics from different sorts of data, bringing different data together. And we still see a lot of cloud services emerging, and still, these investments until the next 5 years will radically still increase and go up and provide more sophisticated services. So this said, edge computing is operating in this environment between data collection, data analytics, giving insights and providing actions. However, you may think in the midterm or in the short term, interacting with these devices, it's nice, but actually what you don't want that, for instance, with the voice recognition, that all your voice is recorded somewhere outside, that raw data is stored somewhere in foreign databases, that your temperature is monitored by a smart thermostat, which is nice, but if the temperature storage and the profile is stored somewhere outside your home, somewhere in central places, people can immediately deduct what's going on, when are you at home, what are you doing at home, and so on and so forth. So people will get more and more alerted about the threats of central data processing related to security, privacy, but also at the same time having login effects and avoiding monopolies on the sovereignty. So we will see in the midterm, long-term trend towards the edge and far edge, complementing today's cloud services and applications. So strong growth of data is forecasted through new ways of sensors, wearables, and intelligent devices, through IoT and cyber-physical systems. We see growing need for computation, the proliferation of computing processing devices, also in your mobile phone, but also in edge devices. We see more need for real-time and safety, for deterministic and mission-critical applications like medical applications. The need for more data security and privacy, more energy efficiency, and data aggregation across a computing continuum, what we see it from cloud to edge and to your local device. There are predictions from IDC that data processing will change in 5 years from 80% in the cloud to 20% in the cloud and 80% in the edge, meaning that data is more efficiently, more securely, more safely processed at the edge where the data is generated at the edge of the devices. So this will what we call a paradigm shift from cloud to edge, basically to far edge on IoT devices, which doesn't mean that the other elements are obsolete. So we need also in the future, we need cloud infrastructure. We need this orchestration between cloud and edge services. You know, there will be new services generated in the cloud. There will be learning and AI algorithms in the cloud, and that will be deployed actually over the air in many cases to the edge where it can be executed. And then, you know, you have that whole range of importance of managing all these heterogeneous devices at the edge, to have that device management in a secure way, in a reliable way, and also to keep up operation, even though there is no internet connection to the central cloud services. So there will be sort of a new balance between the cloud and the edge and the IoT devices, and we see more importance and attention paid to the far edge devices. So how would that look like? We talk about new operating systems. You see on the top of the slide a reference architecture from previous IoT pilot project ActiveAge, where a lot of information is collected and a lot of intelligence is generated in the cloud space. All driven innovation, innovative services are driven by cloud computing, but in the future that might change, in particular when you have to combine private data and public or medical data actually in a way that you have a combination of services of professional health services like telemedicine, professional care services, which is private public, and then the private services in your home for your well-being. And that will be also, you will see more ways of interaction. You see the augmented reality, virtual reality devices. You will see more computing power even on your smartwatch, which would assume different functions and more dedicated and sophisticated functions. You see the coffee cup, coffee is ready or something like that. And you will have more sort of medical surveillance devices, which have its origin not only in the medical domain, but also in the consumer domain, with a lot more shorter innovation cycles and much more higher speed of innovation. So what's the opportunity, I think, for you in Future Horizon Europe? We're looking for these new sort of paradigms and opportunities at the edge. How does a European platform at the edge look like? The target is to improve end-to-end response time and keeping decisions local, optimize operations and device management of IoT systems. Thinking about how does a new operating system with new computing resources, with more data at the edge, more devices at the edge, but also keeping in touch and orchestrating with the upper layers, the cloud services. How does it look like? How could these systems can be used to reduce energy consumption, both from computing point of view, as well as avoiding central cloud processing and larger data centers. At the end of the day, also how would this paradigm shift will be implemented through an orchestration through device, edge, and cloud services. All many questions at the moment, many of the research and innovation perspectives which we draw on there for this topic, which will be open this year. The work program is not published. I think we expect a publication beginning of June, although you find some pre-publications not officially yet and not final yet, but still you get some ideas about the topics you find in the internet. More information you have on that links, and thank you very much for the attention and wishing you a lot of inspiration and stimulating discussion in the workshop. Thanks so much. Back to Sebastian.
Thank you very much, Rolf. Very good and inspiring vision and the evolution of IoT and the transition from the cloud to the edge. Let me now give the floor to Karolina Makiewicz from the European Connected Health Alliance. She will provide vision from the e-health and domain and the perspective and the challenges related to in terms of research and innovation in this domain. So Karolina, you have the floor.
Perfect. Thank you very much. Good afternoon, everyone. And thank you for having me and giving me the opportunity to share with you a story of the European Connected Health Alliance. And through this, I would like to touch on those key challenges and also opportunities in the domain of the digital health. That we as the Alliance recognize. I'm very happy to speak after Rolf, who presented all those challenges from a technical perspective. I will maybe speak more from user perspective, exploitation perspective, from what do we really do with all those technology solutions and what are the challenges when developing them and deploying them. And through the story of the Alliance, I will, as I said, I will touch on those challenges. So the Alliance is a membership organization bringing together companies, policymakers, research organizations, healthcare providers, patient groups, insurance procurers, government, local, regional authorities. And this is because we believe that, well, there is enough fragmentation, working in silos, and of course competition, well, enough or too much, and we should actually work together for making change, for bringing the solutions that matter and solutions that actually can make change when it comes to health and care. So I would say that this is the first challenge, fragmentation, working in silos and competition, but of course there is also an opportunity for collaboration, working together. So we are the organization that connects connect the dots in Europe, but also worldwide, working with the organizations also in Americas, in Asia, Africa, and Australia. So we are the international network of the 55 plus health ecosystems. That 55 plus is because we are constantly growing, and the new ecosystems are coming to the Alliance. So what do we want to do? As I said, connecting the dots and doing this through this network of health ecosystems. What are the health ecosystems? So I mentioned that there is over 55 of them in all continents, of course, predominantly in Europe. So those ecosystems, those are the permanent structures, multi-stakeholder structures, often hosted by well-established organizations. So it's the community of stakeholders gathering to develop a joint health agenda, aiming to address and find common solutions to regional health challenge. And of course, here is the opportunity, the multiplier effect of collaborating in the international network of the ecosystems. So we believe that those ecosystems break down silos, transform healthcare delivery, and of course create the economic growth. And here on this on the slide, on this visual, you have all stakeholders that are welcome to participate in those ecosystems. And here, as I mentioned, there is over 50 of the ecosystems. You can find all the information, of course, on our website, and also maybe join one of those being closest to you. So as a member of the ecosystem, you can, of course, collaborate with other regions, bring the best practices, increase access to international markets, scale up innovation in your region, country, also in the new settings, and well, join the other organizations all around Europe and the world in this work together. So this is something that we see as a response to this problem of fragmentation and lack of maybe collaboration between the organizations coming from different sectors, and not only lack of collaboration, but also lack of exchange of the information about the needs, about the wishes, about the conditions, and lack of the exchange of knowledge. And also in response to this, in response to this maybe lack of exchange of knowledge on the specific topic, we also establish or are in the process of establishing so-called thematic innovation ecosystem. So as the previous ecosystem, there were like regional, geographical, the organizations like from one country or one specific region. Those thematic ecosystems are meant to be cross-border, transnational, and gathering around one specific theme. And also through those topics, you can see or you can deduct what kind of where do we see as the Alliance the challenges when it comes to the word or the domain of the digital health. So what kind of topics we want to, or themes we want to handle with those thematic ecosystems. So we have here health procurement, smart care and aging at home, integrated care, well, very broad, digital health and well-being, mental health as one of the central topics, housing and health, and skills for health. And actually the skills for health thematic innovation ecosystem was launched last month, and this of course focuses on reskilling, upskilling health and care professionals. But of course, one of the very important topic here is generally the health or digital health literacy, something that is not only an issue for the health and care professionals, it's not only an issue for the regular people, but it's also an issue for people like you, or like people working with the technologies, to really understand the domain of the digital health, to understand the domain of health, to really understand why we are building those solutions, what kind of health problems we want to solve, and how to best solve it, responding to people's need. And maybe here I will stop a bit on this person's need. So that's one of the key elements where we would like to also, I would like to bring to the attention. Person perspective, putting the person in the center, being the user-centric, being the person-centric. So not really building the solutions and creating the solutions for the sake of the innovation, technology, using the EU funding, but really responding to the specific need. And this is very painful process usually. It's time consuming. Usually, if I don't know, if I will take the example of, for example, working on some solutions for healthy aging, we think like while doing a survey or doing some focus group with older people will take, I don't know, 1 month or 2 months. And then when you start those test pilots or focus groups, you realize that, well, the older people is not one big group. It's actually as diverse as any other population group. And here we also have to pay special attention. So maybe from that, I will in this moment, I will also highlight this person centricity, building the solution that responds to the real needs and really can help us solve some problems and improve, maintain health and well-being. And I mentioned that, of course, the Alliance works globally, And also here globally, there is also the Global Connector partnership, an initiative established last year, also in response to the global pandemic and global challenges in that area. And with this slide, I would also like to tell you that, well, the European Connected Health Alliance is the organization that engages in numerous EU funded projects, Horizon, but not only, also the more practical Erasmuses and Interreg Europe, which are more maybe on policy side, and why we engage in those projects, and also what do we want to achieve with those projects, and what are also those challenges, what we learn from implementing those projects. So here we see ourselves as the partner that supports communication, dissemination of the results, but also very important exploitation of those of the project's results. And the key challenge that relates to this is not only, well, communicating, but really to share, to spread the message about the projects, to let the other people know what we really, what we as partners or consortia really develop, and how those solutions can be used, deployed, implemented. And on the deployment side, really, this is what we call also the life after that. So what really happens with those solutions developed over the years of the project when the project ends? Who really owns it? Who is really able to take it over? This is a serious challenge in the domain of the digital health, and everyone who works with the projects know it, that when the funding ends, there is suddenly a big gap, and sometimes there is also lack of skills, lack of knowledge, lack of motivation, or simply human resources to ensure the continuity of the funding. So also as the alliance, we try to help those projects to succeed, and with all the stakeholders being engaged in our network to have this whole chain from the development, from the idea to the development of the product, and then further deployment. And maybe still a couple of words coming from, like, some conclusions coming from working with those different projects. Some challenges that I would like to highlight, and I think in that sense I will also a bit repeat what Rolf said. Surely use of data, the whole potential of the health data, personal data, big data, environmental data for health and well-being, that's still not being utilized. But then on the other hand, when we start utilizing this data, when we are excited, like, okay, there's so much data, we want to really embrace this opportunity and use it, we face another problem, like how to really do it in an ethical way, again, in the like user-centric way or citizen-centric way, that we provide the different solutions that, I don't know, monitor health, status of the, for example, older people, but how to really deploy it, that the older people, that our users feel comfortable with that. And one argument that I often hear is like, well, don't worry, this is like GDPR compliant. And I think we have to be really careful with this. What does it mean GDPR compliant? Because with GDPR, of course, there is the consent, and then the consent can be a long paper that someone has to sign, but it doesn't really mean that it's entirely like citizen-centric or it's 100% ethical. Yes, legally all is fine, but maybe it's not exactly user-friendly. So I would like to highlight this and leave this. And then also when it comes to data, the problem of interoperability. I think we face it all the time, and I think there is nothing really new. But it's always important to mention this, and I hope that we can actually make some progress on this to really make use of this data, again, not only for the sake of the being brave and embracing the different innovations and developing the new solutions, but developing the solutions that matter. So this was the short story of the Alliance, and looking at the different challenges on the digital health. And if you would like to connect the dots, or to work together on within the ecosystems or on projects, please feel free to get in touch.
Thank you very much, Carolina. It was a very comprehensive view. And as you mentioned, e-health is characterized by a certain number of elements which are distinct from other verticals, maybe not all of them, but which are quite higher or exacerbated in a certain sense, regarding the need to be very much user-centric, the need to also address privacy by design or data protection by design, which is a legal requirement, but perhaps even more important in the domain of e-health, and which also requires to find new ways to support interoperability and standardization in this domain. Thank you very much for this very good introduction. Let me now give the floor to Giuseppe Fico. Giuseppe Fico has a very long experience across different projects, currently with Gatekeeper, but also in Activate and other projects. And he will provide the vision of the research activities, including in the context of large-scale pilots like Activate. How did the research community manage to address some of these challenges, and what are the upcoming challenges to be addressed from a research perspective? Giuseppe, you have the floor.
Thank you, my dear Sebastian, and all the panelists. So thank you very much for giving me this opportunity. I guess while I'm talking that you can see my screen in full mode, right, Sebastian? Yeah.
Yes, we do.
Perfect. So thank you very much for this opportunity, and to be here with the panelists, that some of them some months that I didn't met, so I'm very happy to be here with you, but also with the attendees. I see some also friends also from the attendees and also from the speakers. So I will talk about our experience in existing experience in the Gatekeeper large-scale pilot. But to do that, I need also to put ourselves in some of context. So that's why I'm also going to mention some of the initiatives that have been fundamental for us to try to play an important role in this journey when it comes also to edge computing and health and well-being. As you all know, it's the most regulated sector, ours. So there are important things that we have to consider and elements that we have to take from other society and initiatives. So as Martin and also Rolf mentioned, we are in a new decade. So in our sector, we are in the decade of healthy aging. Some of you may know that we have been part in Europe of the European Innovation Partnership on Active and Healthy Aging. Now the decade is healthy aging. So health is aging is a continuous process. And there are initiatives that are trying to put specific focus on the SDG and those that are affecting our older adults and populations. So these are elements that we have to consider. You have heard that I am myself the technical manager, but part of the coordination team together with Medtronic and Manspera of the Activate large-scale pilot. It's important to mention this project because that was the first experience on large-scale pilot on IoT solutions for active and healthy aging. We did that together with the other relevant large-scale pilot in collaboration with Rolf, with Martin, and other important projects, and Sebastian, and basically many of you have been part of this journey. As it comes to our Activate experience, I can summarize in a couple of slides what we did and why it was important. This was the first project where we were trying to build in an open innovation approach, services for active and healthy aging. Open innovation means that we had to break some barriers in terms of platforms, vendor lock-in, and other type of barriers that we know that exist in our sector to really implement the Active Age Karma, which is about really creating a personal-centered AHA IoT ecosystem. That experience is continuing, as you said, Sebastian, in the activage.org. So we have created an alliance, an association, really similarly to what has been presented before by Catherine, with the spirit of really creating a domino effect and creating the most important market, which is our European market for active and healthy aging solutions. During the Active Age project, and I'm happy also to have seen a very similar slide from Rolf. This is another view of the same slide. We were trying to identify all the barriers and all the innovations, all the elements, regulatory, technological, business, and other type of elements that are important really to enable this person-centered AHA IoT value creation, which is we are the producers of our data. Whatever it takes, give me services that are relevant for me. Whatever it takes means that we have to overcome several barriers. The GDPR has been mentioned before, but there are many other barriers and many other regulations that are now happening, and you may know that I'm going to mention right now. So that was the Active Age project. We experienced solutions with about 8,000 users. We finalized successfully the project, and we are now actually producing the main core publications of the project. So keep tuned with our results, basically. Now, this is a slide that will put us in context where Gatekeeper is located. So Gatekeeper is now belonging to the second generation of large-scale pilots. Together with other projects, as you can see here, we are cooperating in what is called the Health and Care Cluster. These are actually the starting project, but there are many others that join this cluster. Some of them are large-scale pilot and others not. But what we are doing together is to really cooperate in relevant topics that are important for us. Of course, we are now in the era of the European data spaces, and in particular in our sector, the European health data space. So when thinking about Edge, let's put this is our context. So the governance for the European health data space has to deal also with these innovations that we will now move in the Edge 80%. And the Gatekeeper project has been thinking from the very beginning about all these aspects. So I will tell you why. Before that, let me give you two more contexts. We are collaborating now with the Digi Center in other important reports that are related with our topic today. One is the study on cross-border digital exchange of health services around our countries, with a particular attention of artificial intelligence. So we are looking at the element that we need to consider for really exchanging in a scalable way, but also keeping compliance with the existing and ongoing regulation. The MDR, the medical device regulation, in 8 days will take place, and also the new regulation, artificial intelligence, is of course very much related with our sector and our domain. Then I have mentioned also in my first slide the Alliance of Medical Biological Engineering. I'm now the Secretary General, and also from this type of society, we are looking at how to cope with the tsunami of devices, and now with the edge innovations and even more bigger tsunami of new devices that are coming to the market, and that we need to regulate while not slowing down the life cycle innovation. So these are the challenges that we have to consider. And all these are ingredients that are in the core DNA of the Gatekeeper project that is now developing solutions for artificial intelligence, older adults, for building innovative treatments. This means that is very, very much related with the health and care sector. For this reason, with respect to the Active Age project, we increased our challenge. So we want to deploy solutions not with 8,000-10,000, but with 40,000-50,000 of individuals in regional healthcare systems There are 9 plus 3 pilots, 9 from regional healthcare system from Europe, and we have added 3 from Asia, Singapore, Taiwan, and Hong Kong, and other alliance with new pilots, newcomers are being built, also in collaboration with partners like European Connected Health Alliance and also with Manda International and other relevant partners. Now, the problem that we are addressing in GateKeeper is about chronic disease management. We have built reference medical use cases in green that are characteristic of our incidents and of diseases and conditions all over Europe. And you can see in green that we have added from the very beginning of the project specific use case for COVID and other type of relevant diseases. These are reference use cases that we are deploying. The project is now in the half of its lives, 18 months of life. We are now deploying solutions in all these regional healthcare systems. In other words, we are creating one of the biggest use case of European health data space in Europe at this very moment. To do that, you have been listening about important elements to consider. We are doing that in a co-creation approach with all our pilots involving relevant actors and relevant experience. You may remember the Neighborhood of the Future initiative. So we have taken core partners and core experience from that project to really co-create and see with our pilots, stakeholders and ecosystems what really means to have innovations in the edge and what are the consequences for our populations, whether they are the older adults, the beneficiaries, or other type of stakeholders. The platform that we are building is several ingredients. HL7 Fire is our core standards for breaking the barriers in the healthcare sector. For those that are from our sector, you well know that the revolution that is bringing HL7 Fire in terms of interoperability. To that, we are adding other elements like Web of Things. There will be Dave that will talk afterwards, so I'm not going to spend many words on that. Trust is our core elements, whatever we, as we are dealing with the health and well-being domain. So we are building and defining certification and trust mechanism and authorities. And then we are deploying solutions in a scalable manner in the edge and in the cloud. This is a view of our platform. I'm not going to spend many words on that, but you can see that how we are particularizing the different connection of the type of devices that we have on the market and solutions. And here in green and yellow, you see the artificial intelligence services that we are deploying with our healthcare system first, and then deploying locally in the edge and in the homes of our served population. Fire is a part of this game, as I told you. So it's you can see these icons in basically all the elements, because our starting point is data from the healthcare systems, but then we are moving to other domains and interoperating with other domains with Web of Things. Everything will be seen as a thing. Dave will explain that much better than me. And this is paving the way for our core innovations in the edge and the homes of our older adults. So what we are building is a strategy and a core deployment strategy for optimizing artificial intelligence services, first with our healthcare providers, and then how they can be optimized to run locally in our homes through smart gateways that we are building and we are now deploying in these very days and weeks in our 12 pilots, basically. So for doing that, we are building several types of innovation. If you want to know more details, please contact us. This is the core elements for our artificial intelligence strategy. So you have seen our reference use cases. What we are doing is an end-to-end mapping of all the reference use cases with all our 12 pilots, protocols, ethical approvals, core elements, and we are doing this end-to-end mapping till the very end of our pipeline of artificial intelligence. So this is our strategy for sustainably deploying our data, European health data space for enabled by Gatekeeper. We are doing that with our pilots. We are taking things quite seriously in terms of experimental and evidence generation. So we have our strategy for federated randomized control trial among all our pilots. So per use cases, per pilot site, we have a federation of several protocols. We have a very tight monitoring and control strategy to deploy that, but we are aiming to build relevant KPIs, also including KPIs that are related with the Green Deal and SDO elements to build our sustainable approach. Market is in our radar. We like to call ourselves a business-driven project. So we are building a core exploitation strategy that will involve many actors, and I'm sure that some of you will join our adventure. And this is related also with having scalable, demonstrated, cost-effective solutions that are also aligned with standard certification and procurements. Our open innovation approach, we have open calls. We have finalized the first one, but we have also the second open call where we are enlarging our ecosystem to other sites with challenges that are relevant for all the things that we have mentioned. So I can conclude saying that if you want to know more, this is our website and information, and also that we are really happy to build a federated edge-based learning approach for a new generation of AI healthcare services. With that, I would conclude my intervention, and I will be happy to discuss with you all about all these elements that I hope I've shared in a synthetic but useful way. Thank you.
Thank you very much, Giuseppe, for this very inspiring and forward-looking presentation. I think it gives a very interesting perspective on how research can contribute to bring a change, to bring a paradigm shift. Thank you very much. Let me now give the floor to Dave Raggett to provide some perspectives on the interoperability and standardization part. Dave, you have the floor to share with us your vision, particularly with the Web of Things perspective in the context of e-health. Dave, we don't hear you.
I'm just muted. I apologize. I've got the other, but you can see the first screen, right?
Yes, we do.
Okay, it's good. So I'm going to introduce the kind of the Web of Things, and right. So the Web of Things is W3C's abstraction layer for digital twins. So that's digital twins representing sensors, actuators, and also virtual devices as compositions of other devices, as it were. But it also can be used to expose information services as things. So digital twins as things, as objects with properties, action, and events. And the idea is to decouple the client applications, the details, the underlying protocols and standards, through a scripting API based upon rich descriptions. This makes it easier to create services across heterogeneous IoT ecosystems. So everything has an identifier, an RDF identifier, associated with a kind of rich description, symbolic description in JSON LD. And these descriptions cover the interaction affordances, like the properties, action, and events in their data models. Also, semantic interoperability, such as the kinds of things the units measure, and the security and communications metadata, which is important for secure access to IoT. And so this diagram gives a little more detail. We can see that on the left, the bottom left, we have the current situation where if you have applications which want to integrate, mash up devices from these different ecosystems, you have to know a great deal of details about all these different standards and protocols. On the bottom right, we have that kind of a narrow waist has been introduced for the use of thing descriptions so that client applications can operate through this kind of web, this API, and don't have to know all the details. So it makes it much easier to integrate services across these different ecosystems and devices. And this, I'll talk more about new work in a moment. So the diagram here is from our architecture document and illustrates how the Web of Things applies in the cloud, at the edge, but also in the local network. And so the idea is to simplify usage through interaction abstraction, to simplify data ingestion for the use of common data schemas, to bridge the silos of the different ecosystems through protocol bindings, and to enable mashups, essentially. So I was asked to say something still about use cases. I don't have a lot of detail here. So at the edge, these are some ideas from the Gatekeeper project that you were just hearing about. So at the edge, it's fundamentally about monitoring patient health, like in people's homes for the elderly and frail. Reminders, taking medication, light exercise, and so on, including the use of friendly robots. Warnings for use by caregivers, so family members and nursing staff, a variety of different kinds of warnings at different levels of severity. And then the idea of being able to have privacy-friendly distributed machine learning. So the idea here is rather than moving all the data into a centralized place in the cloud, instead you're able to distribute the machine learning algorithms to operate on data locally, at the edge. So, and then of course there's use cases in the cloud where we want to be able to provide access, integrated access across health centers, both at the regional and national level, but also with third parties, organizations providing services. Support monitoring and research across all this data, across all these patients, and to enable early diagnosis for better outcomes. So some of the challenges involved are we have in the Gatekeeper, we have HL7 and obviously W3C as partners in the project. And so we're looking at how do we integrate HL7's file formats for medical records effectively with the kind of the Web of Things perspective. And so one of the key concepts here is the role of graph databases as the means to simplify working with heterogeneous data models. You can ingest data into a common framework of a graph database. It makes it a lot simpler. And then there's the importance of being able to use shared vocabulary, so it's non-ontologies. Essentially, it's much easier to communicate if you use a common language. So W3C's RDF and linked data provides a basis for semantic interoperability across heterogeneous information systems and sources. So the tabular relational databases, spreadsheets, comma-separated value files, and property graphs. This figure gives you some illustration of the kind of the main pilots for Gatekeeper and what they're targeting. And as you can see, it's spread broadly across Europe. Our initial work on initial standards around the thing descriptions came out early last year. And so now working on updates to those, and these standards are divided into informative standards and normative standards. So for example, the normative includes the thing descriptions in JSON LD and the architecture, whereas the scripting API and security guidelines are considered to be informative. And so we're working on updates to these, but also got new work on use cases and discovery interoperability profiles, which are about, some of which is about to be published. I think I saw these cases should be published very, very soon. This slide shows a little bit more details about how thing descriptions work. So JSON LD is a way of expressing linked data in JSON, which is easier for people familiar with JSON than other formats such as Turtle or XML. And it's been kind of color coded. So we have metadata for IoT services, such as the ID, defined here in terms of a URN, we have a title and a description, and there's provision to do descriptions in different languages, of course. Then we also have sort of semantic information, such as the thing is an IoT light, and security definitions and so forth. And then we have, that was the thing, but we also have properties. So we have one property here, brightness, and again, we have the semantics, and we have its type. It's an integer and it's in the max values. And the forms in the kind of lighter green contains communication metadata, bindings, for example, to a RESTful API exposed by a remote server. And then actions like methods, asynchronous methods. In this case, it's been the idea of being able to fade a light up or down. So we have JSON LD. You can bind your names or terms to RDF URIs. And so that's what the at context does at the beginning. So it's essentially referring to an external set of definitions and also adding some own, in this case, binding the IoT prefix to the iot.schema.org, which is the work going on in W3C, one of the community groups. So we have the idea of metadata for IT services, the kind of interaction or affordances, what they are, how to use them, how to interpret the data. And that's building upon JSON Schema. And then we have the vocabulary extensions, as I just described, the semantic annotations, including work, for example, by 1DM, and protocol-specific semantic vocabularies. And this gives a little bit more detail about kind of the work items, the new work items that are going on at the moment. And so we're doing some work on use cases, trying to identify gaps and overlaps, for example, with edge computing. We're doing an updated requirements analysis for the architecture based on the new use cases. And we're trying to build stronger liaisons with other standards organizations. And the discovery is interesting because, as we've discovered on the web, you don't just want to expose, to allow anybody to discover the details of what's available. That's because that breaks down your privacy and allows you to be fingerprinted. So discovery needs to be in progressive ways, depending on trust. And both locally, search locally and also remotely. And then there's work on interoperability profiles. If you have clients and servers using different protocols and things, the clients need to know, you want to be confident your clients will actually cover the protocols for the servers. And so hence the work on interoperability profiles for out-of-the-box plug and play. So we have some other work. There's some open source implementations, for example, NodeWatt and NodeGen based around Node-RED. And then we have frequent plug fests with the real equipment, and well, that's been a little bit more challenging with the pandemic. We have validation for validating that the JSON LD used for thing description conforms to the specification in the standard. And then there's a load of pointers to additional resources, so you can follow these up. The slides have been uploaded and presumably will be linked from the workshop page. But you can see we have essentially an interest group and a working group. And we have the candidate recommendations, the standards from last year, which are sort of like draft standards in some sense. And then we have working drafts, and we have a lot of editors drafts and issue tracking going on in GitHub. So here are the chairs of the working group are Michael McCool from Intel and Sebastian Kabisch from Siemens. And we have a lot of also Japanese companies involved because they're looking at the kind of the IoT environment in Japan. Finally, I wanted to finish off by looking a bit further out to the future, and because it's all very easy to think about, everything's about the IoT and the edge, and that's the current focus of attention, but we should keep an eye out to where things are happening. As you were hearing, we have the work on AI and Gatekeeper, and there's also work going on, which I'm strongly involved in the W3C in a community group, Cognitive AI Community Group. And so we're looking at future applications of the web of things as smart cognitive agents, perception, cognition, and action. So perception involves intelligent interpretation of data. The web of things, you're exposing digital twins, that's sort of the data, like the properties and the events and so forth. But then you need to interpret that in context. So that's perception. And that can be context-based, depending on what you're trying to do, and also being able to focus the attention on specific things. Cognition is about memory, reasoning, continuous learning, decision-making. Today, deep learning is mostly not continuous learning, it's sort of upfront learning, and you hope that the statistics of the application match the statistics you trained it on. And the idea here, and you're talking about sentient web, it's sentient in terms of being self-aware, through the senses, but also of its own goals and state. Actions is about driving actuators. So there's a demo, for example, from an Industry 4.0 kind of application involving real-time control of a robot bottling plant, conveyor belts and so forth. So that involves real-time orchestration delegated from cognition. So this is really, it's a new generation of AI inspired the human brain. There's nothing yet we've built matches up to the human mind, building upon more than 500 million years of neural evolution. And deep semantics as compared to deep learning, which only deals statistical correlations. So the idea is to mimic human memory, reasoning, learning, and feelings for cognitive control, prioritizing what's important. And this builds upon a combination In large ethnic data, we're just talking about graphs, but here we want to add statistics, rules, and algorithms. And the idea of a web, this enables a web of sentient agents that subsumes the IoT, with agents as providers and consumers of services, responsible, collaborative, multilingual AI, and machine learning replacing the bottleneck of manual development, which is not talked a lot about in the IoT projects. And then there's a kind of a diagram explaining that. So I don't want to go any further details on that, merely to say that we should, the work we do at the moment, we need to be also looking out a little bit further down the road to what's happening and how the, once you've got the data from the IoT, how are you going to build applications with it? How are you going to build smart applications? And so with that, I guess I finished my portion. I'm not sure how we're dealing with the questions and answers, whether we're doing it now at the end of the session. So I'll leave that to our host's side. Thank you.
We can already, I see that the time is fleeing. So what I would suggest, thank you very much, Dave, for your presentation. What I would suggest, let's go maybe through the presentation, and then let's really open the debate. And so I invite all the participants to write down their questions so that we ensure that all the speakers can present their perspective. I would invite the next speakers maybe to try to stick to the time a little bit more closely, so we have more time at the end to open the debate. So now I'd like to give the floor to Konstantinos Fisarakis from Interlit Healthcare Perspective from Sphinx Analytics. And Konstantinos will give you a complementary vision. I think, Dave, you highlighted the importance of the interoperability and the, in particular in the application layer. So that's something we will come back to it in, at the end of the presentation.
Thank you, and thank you also for the invitation and giving me the chance to talk about what we do in the NGIoT project and what we also do at Sphinx regarding applying edge intelligence and IoT in smart health and care. I will not go so much into the admin details about the project, but you can find those on our website. But I will go to the matter at hand, which is healthcare. In NGIoT in specific, we target in one of our use cases, we target patients with CVDs. It's well established that obviously healthcare systems are under a lot of pressure to provide efficient care. Efficient meaning effective in terms of patient needs, but also cost effective, because there's rising need for such services. Our populations are aging. In CVDs in specific, there is lots of impact in human life and of course also economic impact. I have some statistics in these slides from the European Society of Cardiology that you can check after the presentation. I don't want to go into the details now, but it's important to highlight that there is lots of human lives at stake, and obviously there is a lot of potential with IoT and the edge of let's say alleviating this cost, or at least mitigating it to an extent. We have lots of opportunities with edge and IoT for sensing, actuating, reasoning, and so on. And I would say that other than the medical devices, so purpose-built to, like wearables that you get a strap around your chest or something, I think that most of the potential comes from consumer devices. So off-the-shelf devices that the patient would like to wear. And these devices are typically user-friendly, more user-friendly than a typical, medical device. And they're also unobtrusive, which is also very, very important for not deteriorating the quality of life of the patients through this monitoring and all these devices. And it has been shown, of course, that this also increases the acceptance of the technologies and how easy it is for the patients to follow the protocol, let's say, for their treatment. And another angle that is very important is human in the loop. So basically, healthcare is one of those IoT use cases where it's very important to always have some sort of checks and balances. So to have the human in the workflow, because you don't want to have the system automatically take some action or recommend something that may be threatening the safety of the patient. We at InGIoT, we focus on decentralized health and remote monitoring. We leverage these off-the-shelf consumer devices. Of course, already I think Rolf mentioned that COVID-19 has been a big transformation catalyst for the adoption of these technologies and the acceptance of these technologies, and for let's say, you know, the state actors and stakeholders, which are typically not very agile, they had to really adapt to this situation. I have here some off-the-shelf devices, that we are also considering at InGIoT. So your typical smartphone, your typical smartwatch, blood pressure meter, smart weight scale for CVDs. Changes in weight, for example, have been shown to be very important. Another aspect is the smart home devices, so monitoring the temperature, the humidity of the environment, and so on. And of course, also very important when considering COVID as well, smart thermometers and oximeters. So these are typical devices that anyone has, and if you're like some gadget freak like myself, of course, I have all of these devices. So it's not something that is hard to get access to, and this is, I think, is very important. Going into a bit into the details of the use case, we have our patient, which of course has a number of these devices in their home or on them, and we get data. The twist here, or let's say what we're trying to focus on is because of all these security and privacy concerns, we focus a lot of federated learning, where the data, to the extent that it is possible, remains on the patient's premises, in their house or on their devices. All the training of the model happens there, and only the model is sent back to a central repository to get the global model that can be then sent back to the devices. So we avoid sending private sensitive data and so on over the web to a hospital or any other repository. Our aim is to of course facilitate recovery rehabilitation and closely monitor the patient and predict also upcoming incidents or deteriorations that happen to their health, and have the doctor intervene earlier. And of course, hopefully we'll be able to also identify predictors and variables in our models that help in the future more timely and more accurately predict such deterioration to the health of the patient. Of course, for the interoperability, we have already talked about W3C and the what thing description. So obviously, this is one of the considerations we are working with on ensuring the interoperability of the devices. I'll get back to that, because interoperability, especially talking about consumer off-the-shelf devices, is not, unfortunately, a given. So you need to build like a glue to make devices, especially from different manufacturers, talk together. In the case that they give you open APIs, because even that is debatable in some cases. The whole analysis of the use case and the development of the use case and the evaluation of the use case will happen around the three pillars that we have in InGIoT. One is the collaborative IoT. So what I mentioned about federated learning, how federated learning comes together with developments in MEC with 5G, the refinement of the local model and how we can incentivize them, also the patients to participate in such schemes. The human in the loop, I mentioned already about the clinicians need to review the recommendations of the system and the triggered interventions to verify they're safe or they're actual, they're real. And another thing that is very important for the end users from interaction with them is the seamless and usable feedback and actionable feedback on interventions, not to overwhelm the patient and or the clinician with lots of alerts and lots of data. And another aspect that again has been mentioned previously is trustworthiness. It's a very important aspect of our project. So how can you have trustworthy monitoring and intervention? How can you have audit and certification that everything is working as intended? The data of the patient is handled in the way they agreed upon when signing the consent form, that you are evidence that you are GDPR compliant, for example, and also how to detect and mitigate attacks that may happen in the health and care ecosystem. This is the last pillar is because what we do also in Sphinx Analytics and our role in the project and our expertise are on that. And I would like to give a bit more emphasis on that. We have held a number of end user workshops. One of those was with healthcare end users, so clinicians, nurses, and health and medical device technology providers. And I would say one of the key concerns was other than having simple to use applications, they also mentioned the need to have reliability, reproducibility of results, so accuracy and also transparency. And I think the latter element is very important in ultimately building trust on NGIoT applications in general, but in health and care applications also in specific. Trust, is a very strong word. It also relates to human feelings. It's the people that have to trust the technology, and it's not something that will only come through technical means. And as you know, trust is very, very hard to build, and it's very easy to lose. But there are a number of technical enablers that can help in that. In the project specifically, we're looking into providing real-time security and privacy assessment and management of the IoT environment. We are also leveraging DLTs and smart contracts to provide this transparency and this chain of trust for data and transactions. We are leveraging trust-based computing mechanisms for secure routing and intrusion detection in cases where we have a big number of IoT devices. And we also try to develop some sophisticated techniques to detect incidents and not just detect them, but take care of of countering these incidents and making sure that the impact is minimized, let's say. And I would say as a bonus, because usually security is seen as a barrier to the business, because maybe it increases the time to market or something. I would say that it's important to also highlight the potential of trust enablers to create new business models. So federated learning, model monetization, there's a number of things that you could do to help and also give the, let's say, the incentives to the end users to participate, of course, giving them also the guarantees that you're not mishandling their data in any way. A couple of slides on specific trust enablers that I briefly mentioned. One of the core enablers is the Sphinx Security and Privacy Assurance Platform, where we combine threat vulnerability analysis, static analysis, penetration testing, and continuous real-time monitoring to provide a real-time view of the security and privacy posture of the healthcare IoT deployment. It's a model-based platform, and we actually one very important consideration would be to provide what I mentioned before, so the evidence that none of the data had been mishandled, that incident X happened then, and we countered it in that way. So whatever is needed to build, let's say, the trust to the clinicians and the patients. This is, of course, in very tight collaboration with colleagues working on DLTs and smart contracts. We're using DLTs for data handling transparency. What I mentioned before also about ML model trading. It's another angle that we are investigating. So there's a lot of potential there through applying these technologies. And then we have moving target defenses. So at normal operation, how can we, let's say, make slight changes to the configuration of the system to make it harder for attackers to profile and find weak points in our systems, but also during ongoing attacks to apply predefined strategies to mitigate the attacks. Speaking of attacks, we in the healthcare, there is a number of, for example, ransomware attacks. There is a number in IT deployments. There is lots of botnets, botnet attacks. These are things that They're not very sophisticated, but they're very easy to carry out, but their impact is significant. And it's also hard to detect because a clinician or a patient, they're not tech savvy. If his smart device is compromised and is part of a botnet, he will never realize unless you do it for them and you inform them in a way that requires minimal involvement from their side. And you've seen also big attacks with ransomware, for example, in hospitals. And then we have trust mechanisms in terms of when having multiple IoT devices to monitor have peers monitor the other nodes and give us early warning of, let's say, suspicious behavior that may indicate a node compromise. Now, this is actually my last slide. Through all these efforts up to now, we have already identified a number of important challenges in a number of areas. So in the collaborative IoT pillar, I would say one important aspect is model personalization. So how can we tailor the model to the patient, but preserve the overall performance and not break, let's say, the concept of having a global model that can inform the models of all devices. Federated learning, of course, on the edge, on devices that are typically have some constraints. For example, they're operating on battery, and also leverage the 5G and MEC technologies for federated learning. My colleague, Jerome, who is also working on the NGIoT project, will tell you more about that in the upcoming presentation. In Human in the Loop, as I said, we had a lot of interactions with the end users, and for them, usability is very important and efficiency. So can all these systems actually make my work as a clinician easier, or do I have to go through alerts all the time and actually have more work than I had before? And of course, you have to take a balance, because you want to automate, let's say, and filter out as many things as possible to make life easier for the doctors, but you still need to have them in the loop to make sure the system does not give any recommendation that will affect the safety of the patients. And another thing is to seamlessly integrate this technology in the workflows. So maybe in the federated learning, here we also have some conflicting, let's say, goals, because in the federated learning, you say, I don't want to send out the data. I can train it directly with a model, but then there is still the need for the doctor that is attending a patient to have access to the data. So you cannot completely, focus on the technology and forget about the whole workflow or the whole process that is going on already. Trustworthiness is very important. Of course, we have GDPR, as you know. Security and privacy concerns are very important. It's challenging because it's the security building blocks we have for, let's say, our computer or our laptop cannot be applied on, let's say, a smartwatch that runs on a battery that is not for one day, for example. And also, how can you ultimately build transparency? Because the patient or the doctor does not care what is MTD, what is DLT, or all these tech stuff. They want to feel confident, and they want to feel, let's say, comfortable with using the technology and not feel that their privacy is being violated or have to worry all the time about who is reading the data and so on. And then some more general comments that I think are very important. One has to do with the unobtrusiveness of technologies, which goes hand in hand with patient adherence, because if you put so many devices or devices that affect their quality of life, the patients will just remove it and will not participate in the study. Another aspect is, of course, very linked with what we have already discussed in previous talks, interoperability and openness, especially when talking about consumer devices. Maybe the smartwatch X is the best smartwatch with a more sophisticated, more accurate, or so on. But if there is no way for us to get that data or to get that watch to talk with another device from another manufacturer, it's no good. Here, we need some stronger drivers for manufacturers to adopt open specifications and standards. And in these standards, we have to also look into potential extensions. For example, we are in the project looking about mapping DLT persistence into the W3C device descriptions. And this let's say, drivers for interoperability also take us to the next point I would like to highlight, which is the device certification. So, we're not talking just about the medical certification. Our doctors in the project, they say, we want to buy this watch because it's FDA approved and so on. This is also very important. Right now, there is no, let's say, certification that we could say for consumer devices, especially that say that this device is secure in terms of cybersecurity. So it's encrypted, it features over-the-air updates of the firmware, a number of very important parameters that, to me as a cybersecurity, let's say, professional, would be very important. It's like having a CE label that you know that it's the component satisfies certain parameters. We should have like a CE label for cybersecurity for consumer devices.
Thank you very much, Konstantinos. I see that we are just running out of time, but I think it's a very inspiring presentation. If you agree, we will come back to you with the questions once we have finished the presentation. And I would like to give the floor directly to your colleague, Dr. Aristodemos Pnevatisklakis, to present Professor Jerome Hyrie from Eurocom first.
Actually, if you don't mind, Sebastian, could we do it so that we just have the short statement from Jana, and then we do a quick round of discussion with John, and then we continue with row 2. Would that be okay?
If we can be flexible with the rest of the program, because we still have a few speakers to...
Yes, but we still need to fit it in. So I think also it's more like for the flow, and this is what the colleagues have prepared for. So I think it would be...
We can move ahead in this direction, no problem.
Good. So just on behalf of Jana, she sends her apologies. She is not able to join us very last moment, but many of you would know of her and Citra, who are behind many things, but the fair data economy, and working a lot with, of course, the Finnish stakeholders, but also the wider community, including the data strategy people in the European Commission. So short statement. So indeed, we will salvage a little bit of time here from this. So the statement is: data is the new medicine, but we should treat it with care. Data can improve patient outcomes, foster research, and accelerate the development of new health services only if it is shared between stakeholders. So if it is shared and reused while respecting privacy, strengthening people's control over the data, and guaranteeing transparency. Well-defined, openly communicated data strategies are needed, and data governance practices should be planned like any other key function in the organization. So this is very much in line what we heard Carolina in the opening as well, and the EU data strategy. But what Citra have been doing also together with their IHAN, so the International Humans Account number, is to actually try and infrastructure then how do we create these accountable data streams, working closely, of course, with My Data. We know My Data Global and other both companies and public initiatives. So that's the short statement from there. And perhaps, Sebastian, you want John to just give a few short discussion points for the first row, and then we can also be sure that we have covered that, and we will be more efficient in the end.
With pleasure. John, you have the floor.
Okay, thank you all very much for the nice presentations. I hope you can hear me. So I'd like to have your feedback on one point that was raised by all speakers: certification and CE marks. So the question is, what does certification entail in the era of edge computing, right? And IoT and AI. So what actually are we certifying? Are we certifying the hardware, the device, the measurements, the software, the middleware? and how this relates to the emerging regulations about medical device certification and the recent proposal for AI regulation. So that's one question for any of our speakers, and maybe another question for the Gatekeeper project that had a lot of use cases and an edge cloud architecture. So what is the percentage of use cases that are on the edge versus the ones that run on the cloud? So I think we've heard both sides, but because there is a debate, right? Also, if you recall Rolf's presentation, whether data will be and use cases will be cloud-centric or they would be at the edge. So what is the balance of the use cases that you are actually implementing in this project? So these two questions, I think, and if we have time, we can revisit more. So first is about the scope of device certification in the edge computing era, and the second about the balance between cloud and edge. I don't know if Giuseppe, Dave, or Konstantinos want to take these questions.
Let's see who can answer. Maybe one comment on your first question. That's quite interesting to see that in the draft for AI regulation, there is a specific set of provisions for certification of AI algorithm and AI data processing. In the GDPR, another important element which is quite interesting to consider is the fact that GDPR makes over 70 references to certification, but to data processing certification, which requires the usual model of certification focused on products or on management systems to be rethought. So the traditional ISO 27001 or 27701, for instance, are not eligible to GDPR certification. So there is a shift in the way we address certification, and probably our speakers may have some comments on this topic.
I don't know if Sebastian and my colleagues allow me to first intervene.
Sure, please, Giuseppe, you have the floor.
Okay. Well, it's a very interesting and question to answer, and actually this is our very debate in Gatekeeper project, but also in all the fora that I have presented in my presentation before. That was also one of the reasons to catch your attention on that. So I will answer to the first question, and I will also mention something about Gatekeeper. So the new MDR, the new medical device regulation, which is the stricter ones among the others, because it's specific for the safety of devices in healthcare sector, is already becoming a reality in 8 days, and many things will change. Some of them are well known, others have to be still fully regulated and specified. So we are in this very, very important moment right now. This doesn't mean that I want to escape the question. It's the opposite. So there will be hardware, software components in the edge, in the cloud, and in the platform that if the context of use will be a specific ones for taking decisions on the healthcare status and the treatments of these patients, this will mean for sure that even if in the trial, we have to consider this as a specific class of medical devices where we have to make sure that all the quality process, the data is being transformed with clear quality tracking process. And if we want to use, even in the trial, our technologies for making decisions, we have to comply with that. So right now we are internally discussing how this will really affect not only our exploitation, but even our experiments. So when it is an observation or not will determine our decisions from the trial perspective. From the certification and exploitation perspective, then this is another set of discussion we are having. And what I can mention that in order to have a sort of governance of all this discussion, in the Gatekeeper project, we have created two conceptual spaces. One, we called it healthcare space, and the other consumer space. This is actually a way, an abstraction to really derive from the business perspective all our decisions and discussion, whether we want to keep presence in the consumer sector or whether we need to really enter in the healthcare sector. So these are the things that we are managing. Regarding the question on the use cases, well, our starting point is services, healthcare services from healthcare systems. Once this is fully regulated and validated, also from an artificial intelligence perspective, we are now seeing how we can implement this in the homes of our service population. So in principle, all our use cases will be edge and cloud. Percentage, I would say that we will follow the trends of the market. So I would not be surprised that there will be an increment of percentage going from the cloud to the edge, which is actually our one of our goals. Our project is about, it's a flagship project in the how real world data is used with and for consumers. So these are my thought that so far we do have, and maybe I can also mention that with the work that we are doing with the Digi Center, we have analyzed one of the most reference report on artificial intelligence medical devices, the first one to be certified from the Food and Drug Administration. There are some tens of devices that have been certified. The recommendation so far, and I think that also in Europe we will have similar recommendation, is to really establish surveillance activities to really continuously update on the safety and on the effect of the AI solutions that we are building. So the European health data space means also having this observatory for continuous update of devices and certifications.
Thank you, Giuseppe. Maybe I mean, I understand we are in a transitional phase, but just a personal opinion that maybe the certification process will have to change in the future. Imagine that you have a software that is autonomously be able not that just to detect disease, but also to recommend things. So, you know, you have intelligence and autonomy that you didn't have in the past, and maybe certification processes have to be updated
Definitely
as well.
Maybe I was not clear, but that's exactly the point. So this is going to happen, and in this transition, this is what we are going to do.
Dave Constantinos, I don't know if you want to add.
Yeah, if I want to, I think it's very important the differentiation Giuseppe mentioned, because it's one thing to talk about the medical devices, and it's another thing to talk about the consumer devices, because the medical devices, they will only go through a certification process for their accuracy and so on. In the consumer market, it's more like a, you know, Wild West a bit. So they want to release 6 different iterations of the project in 2 years. You know, it's a different mentality, because you know, we show devices like not even a smartwatch, because smartwatches now are borderline. They have some medical features, but like Rolf showed the smart thermostat. If the smart thermostat is on the same ecosystem as the smart medical devices, and the smart thermostat is leaking data or is opening the network to vulnerabilities, this also affects the smart health and care devices on the same network, right? So we have lots of features, for example, in projects for ambient assisted living, where you have smart lamps, you have smart thermostats, you have all this smart to help people with disabilities or perhaps elderly to move around and things like that. So these are used in such projects, and there is absolutely no certification that at least they have a baseline, for example, that they take over their updates for their firmware if something goes wrong, that out of the box, they are connected securely to the network, some basic stuff. We're not talking about, you know, some exotic algorithm or blockchain, or not even mature, good standard practices that are known to, you know, undergraduate courses of cybersecurity are not being taken care of. So their certification is very important, but it's also going to be very challenging, I think.
Yes, exactly, Konstantinos. You are totally right, and these are the discussions. So the new medical device regulation, I'm not a lawyer, and there are lawyers here that may support, but the point is that the way the manufacturer design the product and the context of use, the intended use of that device is affecting also the way they can be used. So there is a gray area in understanding this, because that device can be used as a commercial device, but if the manufacturer has also designed that device with the standards for being used in healthcare, this could be two ways of using the same device. There may be other considerations. There are other considerations that we do have to take into account, and these are actually this discussion on what will determine having a consumer product and what having a product that is used for monitoring the health status and take decision of the patients. The new regulation is mentioning clearly that if you are monitoring and following up and taking decision on the over the health status of the persons, well, you have to do a new set of things and certification and consideration, even in trials and so forth. So there is a lot of uncertainty that will be solved during these weeks and days, but in our activities, we are actually putting together experts and certification authorities also that would collaborate with us in order to take these decisions. And in our consortium, we have leading partners from the industries, from both sides, from the healthcare and the consumer. So this is the way we are now, we are thinking about how to take decisions for the business in our projects. And
okay, very good. I think I think we covered the answer very well. So I suggest that we continue with the program, and maybe in the end we can have time for extra interaction also with the new speakers.
Absolutely, I'm looking forward for that. Thank you, John, for your question. Let me now give the floor to Professor Jerome Harry, so we can continue with the presentation. Let's try to keep the presentation really in the agreed time, so that we have time at the end to still have some discussion and interaction. So, Jerome, you have the floor.
Hello, hello everyone. I'm Jerome Harry from Eurocom. Can I share my screen, or should I? Okay, I can share my screen. Good.
Yes, you can.
Okay, so I will try to keep it short. I made only a few slides. So I would like to make a complementary presentations from Konstantinos before on the Intel IoT projects, where we look more on the challenges in the 5G architectures, from moving from a pure 5G to a MEC, and finally to an edge architecture that we plan to do for smart health and care applications in Intel IoT. So in considering the 5G architectures for Internet of Medical Things, if we look at the traditional strategies, so we have basically sensors and body sensors, which can be either 5G ready or cellular ready or non-cellular ready types of sensors. So if they are cellular ready in one way or another, they will reach a specific 5G G node B and over a 5G RAN. They can either be direct, or they could go over a phone relayed over another technology, for example, but they would be this way. Or it could be non-5G technology, so they go directly over another type of solutions and reach a specific wearable cloud. Those who are 5G ready might also reach a wearable cloud. And eventually we have here the health cloud applications and potentially the hospitals. And we have here the components from the body sensors. So one of the challenges for the body sensors is obviously the heterogeneity in the sensors. I think Konstantinos mentioned that before. In 5G aspect, we even have more challenges because the cellular world has been developing sensors, Cat-M, for example, Narrowband IoT, which are actually 4G technologies, 5G ready, but 4G technologies. And recently something called NR RedCap, which is a new directions that would go also for sensors in the 5G technology. But they are not that well deployed and available for medical body sensors, for example. The second challenge we have is obviously the fact that if we have a large amount of sensors, then we have to also to be capable of getting all the data getting out of basically human bodies, and that requires massive machine type communication capabilities from a 5G architecture, for example. And if we move more toward the cloud, we have another challenge, which is this time more about data. It's the fact that the IoT systems are strongly developed in silos, in the sense that if you have a specific body sensors, that it will get to its own wearable cloud. If you have another types of body sensor, you will have another wearable cloud. If you have, of course, 5G, then you might actually go to a 5G cloud. But then you are in the silos, and communicating between these two types of sensors is complex. Even in the health cloud, it requires semantics understanding and also privacy aspects, so that we can actually merge information here and provide a specific information. And final aspect that is challenging also for 5G is the data flow, in the sense that here we have strongly private or personal informations that are actually transmitted over a 5G architectures up to at least the health cloud or to the hospital. And here, this is a 5G architecture. It means that it might, we never really know who is the owner of the architecture, of the infrastructure. It could be any kind of operator, and we basically have a potential a slice over it, but still we are transmitting information that are highly sensitive. So these are a challenge that has to be solved already for 5G. Then we can move to a first step of solving part of the challenge that I just indicated before, by bringing a 5G MEC architectures closer to the 5G infrastructure here, where we have something. I basically wrote here health MEC and not wearable MEC, because here the idea is to think that we have health cloud or health applications, and there is a sister MEC system here that is capable of locally processing informations already here, and for the application and communicating with other wearables. So from a pure component perspective, it solves part of the problems because now we can actually start merging information here, or at least we can have IoT platforms that can negotiate with the different IoT silos to be able to gather information right here and reduce the potential load of informations. We could also have advanced AI technology that can do already machine learning or data processing here, such that whatever goes further will actually be anonymized or at least processed, so the data doesn't leave a specific MEC. And as this is a health MEC, then we can actually guarantee some kind of privacy here. Another benefit of the 5G MECs is the fact that we can talk to other MECs, or we can talk to other potential clouds. Typically, if we have non-5G technologies, then we can partially solve the silo issues by leaving the health MEC to discuss with other wearable clouds to negotiate the access of data here. But of course, this is a big if. It's not clear how we can get that. There is APIs that we can get, but it's very on a case-by-case basis. So that's, even with the MEC, we still have some potential issues at that stage. But at least we solve part of the anonymity and the sensitive aspect in the data by staying at a specific MEC. But one thing that we still have to solve is still, of course, the fact that we're still far from where data are. And what we want to do in Intel IoT is to bring everything to the edge, basically. So using edge device or edge architectures to keep data as local as possible to where the data is actually sampled. And in this extended architecture, we can already see that, of course, there is a big role in edge devices. So here we have the smartphone that is capable of course, connecting different sensors. You will tell me that, well, this is already existing. Most of the body sensors can connect to smartphones, but or to an edge device. The problem is the data interoperability is still in silos. It's very difficult to guarantee that one specific body sensor can share data with another one. But so from a pure RAN or communication perspective, this is maybe not the most difficult part. The most difficult part would be to build something that the cellular community called a personal IoT, in the sense that in this area, then we can basically create some kind of a bubble that guarantees that the multiple body sensors would be able to talk to the edge device because at the end, this is the personal IoT of the owner of the basically of the person that is under treatment at that stage, and therefore there is no issue about trust or privacy aspects in that case. This could also work if, for example, we have non-5G technology that would go over a gateway. The personal IoT strategy will also connect to the gateway and use it here. One thing that is also important is the edge itself might not be one device only. One of the challenge that we also need to tackle, and the fact that the edge device can actually move. We cannot expect the patient to always have the smartphone with him. It could be that when it's going out, he might have the smartphone. When it's home, it will use another gateway. So at the end, the edge device might move from any kind of device that is available, keeping the trust through this personal IoT concept that is currently discussed in 3GPP. Then if we move a little bit further, then obviously we have the 5G MEC, when we have still the health MEC, and here we still need to find a way to have access to data that would not be able to be part of the personal IoT architectures. So having this link between the wearable cloud and health MEC. So that's another challenge that we have to do here. But one key applications that we can do here when we want to have is to absolutely keep data local. And one of the directions that we follow is to rely on decentralized AI, or something called federated machine learning, where when data doesn't need to actually lead. Usually in traditional machine learning, you're going to be at the MEC. If I go my slide before, so I would basically get all the data to the MEC. I will do machine learning for learning, and then I will also use the MEC for machine learning for acting, basically. What we want to do here is and what you can also sometimes do in the first generation of Edge AI is to have machine learning learning and training at the MEC, which means that all data has to move to the MEC, and then you're going to transmit the trained models to the edge nodes, that could be here a smartphone or something, so we can use it. But in this part, what we do is we actually want to do the learning and the processing at the edge. So then we add one extra challenge, is we need to have applications on the edge device. So first the edge AI. So that is where we're going to have AI workers that are going to get the data from the body sensors, train the specific model, and only the model will be transmitted over the health MEC. That has multiple advantages. One of the advantages is it solves basically the massive machine tap challenge that we have to do in 5G, in traditional 5G, because now we transmit much less informations, and also it's much we solve also the privacy aspect, because now we only transmit models. The federated machine learning strategies can also be used and can be also solutions for the proxy AI that I defined here, in the sense that we might want to merge silos, but the silos, they will never transmit us the raw data, but we could transmit them a model that they would train for us, and then transmit back the model that we can integrate into the health MEC. So these are another solutions that can be done by this decentralized machine learning or AI over a specific 5G MEC and 5G Edge. And one thing that I didn't mention before is that we had here the Edge IoT application, which is here an IoT platform that is there to manage this personal IoT, such that the different sensors can join this personal IoT and exchange information in a private way. And from the data flow, then we can see that now raw data are only stays in the personal IoT, and everything is transmitted as knowledge, which is also a key aspect that we can solve with this 5G architecture. So from in terms of 5G challenges, we see that now we move really closer to edge, but one of the challenges will be the management of the edge by having smart controllers. So edge controllers located at the MEC that will manage whatever happens in the edge device here, but also in other potential silos and other potential clouds, such that we can have a controlled information or application for smart health and care. So to conclude, I just wanted to list a little bit potential, quickly some potential SDOs to follow in that directions. Obviously, W3C Web of Things is a key SDO to follow. It was presented before. Potential for there is different use cases. There is potential directions like private health, edge computing, data and semantics are typically where we have to work on, because here, as we are in totally decentralized solutions, we need to discover the services, we need to discover the capabilities of the different edge devices to see if we can train them, if we can learn, if we can use, if we can keep privacy. All of this is really critical. AI IoT, obviously, there is also the complete edge AI architecture that we also can follow for health and smart health and care. Etsy MEC, which are there for the discovery of the different MECs and edge orchestration. So here we have a specific MEC apps which are orchestrating edge applications here and across clouds as well. So we need to be able to discover the different MECs and clouds. 3GPP with the personal IoT. This is, I think, one key direction that would be very interesting to follow in a few months and years, to build this kind of bubbles around data for the health systems. I didn't mention here 3GPP, also RedCap, so the new sensors over 5G technologies, and eventually the 3GPP MEC as well, for exposing network functions, creating the private 5G, such that we can have in a telco 5G architecture a private MEC architecture, so we can manage and keep our own informations. So that's all for my brief introduction to these 5G architectures. Thank you for your attention. If you're interested, you can check out our NGIoT platforms, Open Interface, the Open 5G Run, Mosaic 5G for the Agile 5G management, and our IoT platform for the cross-domain Edge IoT and embedded AI. Thanks a lot.
Thank you very much, Jérôme. Let me give the floor directly now to Aristodemos to make and to lead the next presentation.
Good afternoon, guys. I'm trying to share the screen, but apparently I cannot. Okay, now I can.
We see you. And if you click on the share screen button,
yes, I was trying, but somebody else was sharing before. So we heard earlier from Jana that data is the new medicine, and at Innovation Sprint, we'd like to separate between clinical data and data from our lifestyle, the so-called real-world data. And this presentation about what we do with real-world data in healthcare, how we collect them, and how we process them. Now, the significance of the clinical data in healthcare is paramount, and in the iHealth project, for instance, we call them primary, but also behavior and the environment play a significant role in healthcare. These are enumerated using real-world data. In iHealth, we call them secondary data, but especially in chronic conditions, they are of paramount importance. Chronic condition patients spend their therapy usually outside of the clinical setting, and there we follow up on them using real-world data. What do we collect? We collect measurements from IoT devices about behavior data, the physical activity, the sleep, also physiological data about the heart rate, oxygen saturation, and other measurements, and finally contextual data that come from the environment. But also we get subjective reports directly from the patient, like questionnaires that are asked on demand, self-reported symptoms, some clinical exams, and also social interactions that we can find out about. In Innovation Sprint, we have built a platform called Healthenzia. That's an ePro eCOA platform to capture real-world data. It's a class 1 medical device, and it's used in many studies in therapeutic areas of oncology, infectious diseases, and chronic conditions by top pharmaceuticals, by hospitals and insurance companies. We don't only collect the real-world data using clinical trials and in-health and e-health digital therapeutics application, but we also unfold the potential of AI processing to extend the knowledge extracted. For this reason, we discover digital composite biomarkers. We try to explain their decisions, and we also perform digital phenotyping of our patients. Having done that, we can offer smart services like risk stratification, virtual coaching, and in silico trials. Biomarkers in Healthenzia are actually multiple measurements combined into a single metric. This is usually done via a predictive machine learning model, and we use the composite biomarker in disease diagnosis or outcome prediction. How do we come up with it? Well, first of all, the domain experts identify the clinical objective. So these are the significant outcomes that need to be predicted by the biomarkers. Then we define the composite biomarker. This is a collaborative selection of the most relevant attributes that can composite the biomarker. And this is done together by the domain experts, but also the technology experts that know which devices they can use and how they can actually get the measurements. Then follows biomarker discovery itself. That's a supervised machine learning method. We train a discriminative model. We select the algorithm, we train and tune its parameters, and we evaluate its performance. And finally, we use the biomarker in outcome prediction. This is the online prediction of the outcomes, and also the interpretation of these predictions in terms of the important attributes that can lead into us giving advice to our patients. Another thing we do is phenotype our patients. So we start with our population, and we cluster our population in meaningful groups. Then we model each one of these groups, and we end up with our phenotypes. In the different phenotypes, we have very different distributions of the different attributes. And then we use these phenotypes to discover and explore the patient trajectory across these phenotypes. Ideally, a person will end up behaving along one of these phenotypes, but behavioral changes throughout their lifespan can lead to jumps from a phenotype to another, or even the change between work days and holidays can trigger such things. Because getting actual data is quite difficult in terms, because we need lots of people, lots of time to gather enough data for our machine learning. We also build in silico studies to collect data, and there we have different ways to do this. One way is to take the domain knowledge and understand the behavior of the patients in different conditions. This allows us to feed with models a behavioral real-world data simulator that actually gives us the data. But also there might be the case where we have some phenotypes or some scarce data to begin with. And from this data, we can create generative models and utilize these generative models in order to get synthetic data that follow now a data-driven phenotype and not a certain behavior that we have identified. Finally, we might want to extend the existing data. Extending the data both across time and finding more people is quite easy, but we are also working in extending data that we have from legacy studies and to actually discovering how these people would have reported stuff that were not available back then. For example, some older studies might not have data about physical activity of a person. Nevertheless, we can utilize the phenotypes from newer studies that include the old parameters, but also new attributes, and do some partial matching of the data in the existing complete phenotypes. And this matching will allow us to generate the missing attributes from the phenotypes. Having done all these things, we apply our platform in different European projects. A rather different domain is Infinitec, where we apply Healthenzia in healthcare insurance. There we utilize our system to collect data, but also our in silico study system to generate data. And all these data are fed into the Infinitec sandbox for data cleaning, anonymization, storage, and then we actually calculate, establish the lifestyle profiles and the lifestyle classifiers that we use for risk assessment. We also are working there for fraud detection, because many people today try to fool their activity trackers just to get the extra badge. Imagine what they would do if they knew they could earn some discount because of their good behavior from their healthcare provider. And fraud detection is based on two things. One is actual signal processing, trying to detect outliers and discard them, but also trying to offer useful services, coaching services to the people so that they wouldn't want to actually try to tamper with their data. And that's how we address fraud in insurance, in Infinitec project. Another project is Terminet. There we actually position our platform at an edge node, trying to interconnect different hospitals. Every hospital is at an edge, and there we collect data either from the environment of the chronic disease patients, or from our system, the Healthenzia, or from their activity trackers. And all this data goes into the edge node for some processing, establishment of short-term history, habits, and trends, but also for federated learning. And then we use the Terminet architecture in order to actually transfer the model around the different nodes and perform the learning from using data from our other edge nodes, so our other hospitals. In conclusion, we also use Healthenzia in the iHelp project that is about coaching patients, oncology patients. And in this project, again, Healthenzia is at the edge and where we collect data from our patients. But this data is used within the iHelp platform in order to build models and derive personalized advice that is fed back into our system and finally to our patients. Thank you very much. I hope I managed to save some time.
Thank you very much, Aristodemos. Very interesting presentation. Let me now move directly to Bert Verdonk, Program Manager and Health Data Initiatives on GaiaX from Philips. We have still two presentations, then we will have some time for discussion. We have the vision statement and then the closing remarks. So we will try to be efficient in the upcoming presentation. Thank you very much, Aristodemos, and the floor is yours, Bert.
Okay, thank you. Let me share screen here. Can you see the screen?
Yes, we can.
Okay, thank you for this opportunity to speak today. I'll give you a perspective from the point of view of Philips about using IoT and Edge applications in healthcare, but also make a link to the Gaia X program where we are an active participant of. First, starting with the trends around us that drive us to these development of these solutions. And there are some strong trends out there already for some time that will shape the future of healthcare. And many of these trends are clearly accelerated by the COVID pandemic at the moment. Most economies in the world are already spending too much money on healthcare, and we need to optimize the way healthcare is delivered. That is driven by aging populations or the rise of chronic illnesses, and also more recently the threats of pandemics that have a very large impact on how we can make healthcare delivery, keep that sustainable. We still observe high fragmentation in healthcare systems, so we need to try to let these health providers collaborate more effectively amongst them and provide the right level of care to the right patient at the right moment. We see a slow transition from fee-for-service systems to systems which compensate care delivery in return for value. Is everything we are delivering actually effective? How do we measure that? How do we close the feedback loop on the outcomes of the treatments that are given? And we also observe a big proliferation of data silos where all small pockets of data are collected and people try to optimize the data pocket optimally, but actually the value is in combining those data sets across those data silos. So we observe a lot of problems where technology can at least provide part of the solution to these. And some of these are listed at the bottom of this slide, and digitization for sure is the main element which we try to use. And there are many technologies that are experimented with by our companies, many companies, where we try to use some of these technologies to the benefit of making the healthcare system more effective and actually contributing to a healthcare transformation. That is cloud and edge, and we will need both. That is AI, more data-driven solutions where we develop smart algorithms, machine learning, other algorithms to use all of that data collected in an effective manner to trigger and to alert health providers at the right time without overburdening them with too many alarms, because there's a very dangerous trend towards alarm fatigue. We see a lot of new sensors being developed, connectivity solutions for those sensors, also robotics getting used. So it's an actually very exciting domain in order to create progress in many areas as illustrated on the slide, from advanced visualization, analyzing genomics, continuous health tracking. We heard about the real world data tracking and the importance of that, but also studying not only on the one hand personalized care, so optimize our treatments really to the individual situation of the patient, but also study population health and understand, are we actually delivering care in an optimal manner to our population? And that is of a major concern of public policy makers and of the public interest at large. So what do we need? So how do we really create a breakthrough here in this, given all these challenges? We strongly believe, and that is our vision, that we need a longitudinal 360-degree health profile of all citizens, also when they're still healthy, in order to keep them healthy, but also of patients. And there is no party who will be able to do that on their own. Hence, we need an ecosystem, multi-parties to collaborate in order to bring that data together around that citizen, which allows to aggregate the data you see on the bottom left part, all of the touch points that the patient may have with labs, with doctors, with a hospital, with an imaging center, but also a payer, an insurer who has an interest in optimizing the care for that patient. And so all these parties around the patient need at a certain point of time to exchange data with each other. But we also need to be able to aggregate at the national and the European level, such that we can learn from the impact on the population. For that, we need a secure, open, federated health data space, which incorporates cloud and edge technologies and services in a seamless manner. Seamless, secure, and compliant with privacy and other legislation. So that's quite a challenge, and we've seen a lot of worthwhile pilots and projects being done across Europe in the last couple of decades even. But what we see where many of these pilots stop is at the phase where they really need to scale up and have a larger population impact. We've seen very promising technology deployments which have benefited a couple of hundreds or a couple of thousand patients, but we really need to be able to scale up to tens of thousands and millions of patients and have an impact on at a larger scale. And another issue we still have in healthcare is the lack of interoperability. There are still too many standards, too much variation in the way we connect devices. We've heard some of those struggles from our previous presenters, but also in the clinical domain, the ontologies, the terminology, the coding standards, there's still too much variation to really make this data interoperable at the scale we need it. So those are two major challenges we still see in this domain. We believe, and that's why we participate, that the Gaia-X initiative can alleviate some of those issues. The project was initiated to enable a secure, open, and sovereign use of data. And that is relevant in many sectors, also in the health sector. And that's also the trend in our societies, which a Citra organization, for example, is very much advocating for. We want to give citizens a self-determined decision about how and where their data is stored, processed, and used within a data infrastructure. And the Gaia-X project tries to step forward with governance, with policies and rules, and with a technical architecture in order to enable all of the objectives you see on the slide. Because we need to access and to share data across multiple data silos, across multiple infrastructures. We need to build data ecosystems and a federation of such ecosystems, because we don't even want all our health data to sit in one hand. We will need to live with the fact that our health data sits in different places, but selectively, we want to be able to exchange it and combine it at the European level in a transparent manner. And we need to build out the enablers to create such digital ecosystems, including the security, because it needs to be a trusted system and with all of our rights protected. So that is where the Gaia-X initiative stands for. Let me click further. Yes, this is how the overall Gaia-X infrastructure looks like. In order to enable two things. The bottom part of the X is our infrastructure ecosystem, and that is the place where we look to a more controllable and a more open, transparent marketplace for cloud and edge services. And the top part of the X is where we build out a data ecosystem. So at the top part, we also need to ensure the standards and deploy standards for data, for semantic interoperability, and some additional services in order to make this really practical. And Gaia-X is trying to do that for across domains and across sectors in order to enable the smart services at the top that we all wish and desire. And in the middle of the X, you see the common federation services that a consortium of industry, of associations and governmental entities are collaborating in order to enable that services infrastructure. Now, applied to healthcare, we see that in healthcare itself, just the healthcare domain, we have multiple data systems with lab data, monitoring data, devices data, behavioral, we heard that before, data. We need to embed algorithms in there such to translate all of that data into useful signals and useful alerting signals, such that they can be consumed by the smart services we see illustrated at the top. So this is how we apply Gaia-X to the health domain, and we've actually described in a positioning paper a multitude of use cases and practical applications of that infrastructure. So summarizing it slightly differently, we have a bottom foundation layer. That's where we want to figure out those edge technologies, those cloud technologies, such that we can have access to all of those data sources. We aggregate them in the health data spaces in the middle. That's where the semantic interoperability taps in. Do we really understand how we code and store that data, how we make it accessible, such that at the top layer we can create those health applications and services that that we need in our modern age, and the applications that can help to resolve the main issues in the health domain. Now, finally, bringing it back to Philips, we ourselves, we have also our health platform, and this is a schematic of the Health Suite system of engagement. So Philips is not so much in the bottom part, which is the system of records. Those are the systems which capture the original patient records and all of the doctor's notes. But we focus a lot in that Health Suite system of engagement on that layer here. And in there, you see that we have services to unlock devices for continuous measurements in the patient's vicinity, an IoT platform with all of the privacy and access control, the data sharing capabilities around it, and also ecosystem APIs. And that is where we collaborate with the Gaia-X organization too, and with other industry partners to really build that out in a set of standards that we can share across our sector and with other sectors, such that we can make this really a multi-vendor environment. And by doing so, we then enable these ecosystems which can address the really complicated clinical issues and bring progress in the clinical pathways that we try to conclude. Again, all of these need to resolve the main bottlenecks we still see in scaling this in a secure manner, in a performant manner, scaling this to the tens of thousands, the millions of population that needs to use these solutions, and as well a breakthrough in the interoperability side of things, so that we really understand the parameters that we extract from these connected environments. So those were my main messages, and back to the moderator.
Thank you very much, Bert. I think we already see a certain number of common patterns among the different presentation or concerns with regards to the need to address both technical challenges, but at the same time compliance with a certain number of requirements, and interoperability as a major challenge to support scalable e-health technology and market. Let me now give the floor to Pasquale Anichino from Archimed Solution, who will provide a complementary views from precisely the compliance requirements and personal data protection compliance. Pasquale, you have the floor.
Yes, thank you very much. I'm just sharing my screen now that I can. I hope you can see it. If you can confirm, Sebastian.
Yes,
okay, you can see my screen. Very good. So I will start from the beginning. So thank you very much. I understand that I am what separates you from the discussion and hopefully also from your coffee. So I'll try to be as quick and efficient as possible. Many of the issues have been already touched upon, so that in healthcare, the role of trust, a constant trend in all the presentation that we have heard. I would want to share also some new issues and challenges that we will face, which go beyond compliance as well. Concluding with an issue which goes also beyond, strictly speaking, healthcare, and between compliance rights, which goes into the last stream of research, which is what is called neuro rights. And we know that this will be also important for all of us. So trustworthy data ecosystem, we have heard the role of digitalization, the issue of data sharing, of course, key here. What we have to learn is that e-health, I think, having also participated in CSA or research project, is the key vertical to understand advancements in several horizontal fields. And we have heard that. The field, we have to stress it again, from a policy perspective, is particularly important, of course, following the EU COVID-19 and all the effort also that the European Union is putting in developing a European-wide approach to health and then to e-health. The thing which we have to stress 2 points. I think the regulatory ecosystem is becoming very, very complex. I take part in NGIoT, but I also contribute to Gatekeeper, another e-health related project. Every day you have new updates from the regulatory point of view. And as also MedTech has recently stressed, we will have to assess also the cross implication of the different regulatory ecosystem, being the GDPR, being the NIS directive, being the e-privacy directive, being the Data Governance Act. We have contributed with Working Group 5 to the consultation opened by the Commission on Data Governance Act, being the new proposal for artificial intelligence, being the new medical device regulation. I have already mentioned 6 regulatory ecosystems which intersect each other. Plus, we have to add to that what we have heard also in the last presentation, new developments on the European health data space. So it's a very, very complex normative and legal ecosystem. And I use the two notions on purpose because legal and normative can be quite different because they imply legal and also the ethical dimension. And I always stress this kind of double implications there. Now, what is the point of this? Is an article which has been recently published by the Journal of Medical Internet Research. The title of the article is, I have it here with me, Revolutionizing Medical Data Sharing Using Advanced Privacy Enhancing Technologies, Technical, Legal, and Ethical Synthesis. The authors suggest new technical tools to improve data sharing in the health ecosystem. We know what are the problems of centralized approaches, especially from the point of view of data breaches. If we look from a privacy perspective, compliance, we know what are the benefits of decentralized approaches, which is the second figure here. And we have heard also about federated learning in quite a few presentations. So technical tools are advancing there. The authors of this, I think, a very good contribution also suggest new techniques for data sharing, like homomorphic encryption and secure multi-party computation. They do, I think, they do a very detailed analysis to show why these techniques are GDPR compliant, and I think they provide a very good input to our conversation that we are having today. There is the ongoing discussion of Gaia X. This is taken from the Gaia X presentation, and we have heard just in the last presentation why this is important and why this is important also from an edge perspective. Also, if we take into account the edge cloud debate and the role, of course, of smart wearables and the processing that can take place at the local level. So from a European perspective, I want to stress also another dimension besides the technical and the legal dimension, which is the geopolitical dimension, which we don't have to neglect. The way in which we understand data, personal data, and philosophically, you can say the self and the human being is quite different from other nation states, I would even say civilizations. And this is why it's particular. I mean, the technical things that we are discussing have also very huge moral and political implication, and we should never forget that. I mean, what we discuss is not only technical. Can seem technical, but discussing interoperability and data sharing is not only about that. It has much more relevant and important implications. This is what Gaia X presents as a model for their data sharing. So you can see how the things are becoming complex from the point of view of public research data, hospital, doctors, patient data, apps, wearables, and so on. What is the issue with the cloud and the role of edge? We have heard quite recently about this conversation. Some of you might be familiar with the case, which was a case that put one against each other the French Data Protection Authority, the CNIL, and the Conseil d'Etat. The French Health Data Hub, after Schrems 2, which, as you know, is the decision of the Court of Justice of the European Union that created some problems with sharing data with the United States. Basically, the CNIL raised concern for the data sharing with Microsoft of the French Health Data Hub, and basically wanted to prevent that to happen. That's the typical cloud discussion that you have. The case went before the Conseil d'Etat and the court, basically there was an overrule of the CNIL position there, which was also influenced by the COVID situation. I mean, France needed to process those data through the system that had in place. The interesting thing of this case is that the servers that in the data center that Microsoft was using in that case were in the Netherlands. But the CNIL still raised issue because the data were processed by an American company. Therefore, US authorities could potentially have access to those data, even if the data center were located in the Netherlands. And there are also previous cases, American cases there, where US authority tried to access personal data of European citizens with the notion of control by a US company, even if companies were storing their data in Europe. So this will be an ongoing concern in the technical discussion between cloud and edge, where there are data protection implications. I want to quote this from Rolf, which is one of the statements that we have had access to. Rolf, I think, rightly so stressed that with the next wave of emerging Internet of Things associated with massive increase of data, edge computing will harness the advances in AI and computing power at the device level, enabling processing closer to the source of data generation, things, and users. And I think that, I mean, we have to stress this dimension of edge because of the problems which you might have with cloud, which I just stressed before. I was reading before and sharing with some colleagues from Gatekeeper this discussion that some European projects which work on health data with China have. Can you do data sharing agreement with the Chinese company and send the health data to China? Well, my my solution to that would be to wish you good luck, but I want to say which is a quite complex thing to do. So edge, it's an important focus that we want to have. This the impact of AI, plenty of discussion here. The proposal of AI has been discussed in many presentations. So there are a lot of documents and guidelines which stress the importance of guaranteeing compliance now with the upcoming AI regulation, both from the European Union and from the Council of Europe. So this is something that we have to take, of course, into account. The last step, which I want to share with you, is the development of neuroethics. Now, we are used to have these debates on the patient, hospital, data which we share with platform and with devices, but there are ongoing scientific conversation, which will have its implication there, on the role of neuroethics and neurorights. So the kind of processing which also happens in our minds, in a sense. And here I want to suggest, for those of you who have an interest, again, this very interesting article which was just published, Toward the Human Rights in the Age of Neuroscience and Neurotechnology, which moves, I feel, the conversation a little bit farther than traditionally held conversation that we are having, which are highly relevant and important, to which this is a new building block, which I think soon we will need to add. This is by two researchers from the Basel and Zurich, which are working specifically on neurorights. So this adds another layer of complexity to the already complex regulatory framework, which we have seen. It's already in place or is upcoming. Two final things which I want to stress. One is the role of data ethics that we are working on in many projects. Gatekeeper, one of them, we are working on ethical and privacy impact assessment. Why? Ethics and data ethics is important because, as many research already suggests to us, people will not trust devices and adopt devices and solutions if they, of course, don't trust the device and the way in which data will be handled. So building in a data ethics by design approach into the deployment of solution and design of tools will be key. Simply not because it's the good thing to do, which actually is, but because otherwise you will not be able to sell product in the market, which is the business side of it, which I would say is also important. And in fact, we also try finding new documents by ENISA. Some of you might have seen the ENISA document of February 2020 on the role of data ethics in public procurement, how hospitals and all the health provider deal with public procurement, with the kind of devices they buy and then they use. There is an important ethics component there, and that was stressed also by ENISA. And this reference to ENISA adds the final layer of complexity, which is the cybersecurity dimension. Here I have shared with you the last tweets of the Irish National Health System. You might have heard there was a major ransomware attack against the Irish national health system. This has created serious troubles in Ireland, delay of many treatment of patients, and this is still an ongoing situation because the Irish government refused to pay the ransomware. So you see how many dimensions we have to consider in this very complex ecosystem of the health, which is as a multi-stakeholder, we need to have a multi-stakeholder approach plus an interdisciplinary approach to consider all the different implications that there might be. So I want to conclude with Feynman, which wanted to stress why he likes to teach the students and also why he likes research and interact. And you have to work to doubt, to think, to communicate, to question, to make mistakes, to learn from your mistakes, and more importantly, to have fun in the learning process. And I want to say that so far, I have had great fun with many colleagues which are also present today. I have learned a great deal, and I hope to continue to do so. Thank you very much.
Thank you very much, Pasquale. Very inspiring presentation. I think it highlights the interdependency between the technology and the society and the normative aspects and ethical aspects that we need to take into account. Thank you very much. According to our program, we are a little bit late, but we have planned to have part on visions and statements. So maybe I will turn to Martin Brinskoff. How would you like to proceed with visions and statements? Shall we give some time to that, or shall we start first by having some discussions, some questions regarding the different presentations, and to invite John to perhaps bring some questions to the...
I think while John and the second part of the interventionists here prepare, I suggest I'll just present the overview of the statements because it's very quick, and then we can take some discussion, and we should leave just 5-7 minutes in the end for the conclusion. Yeah, it's okay.
Very good, fine with me.
So for those of you who haven't seen on the website, there is well, the opportunity to give some statements, and we have received some, and I'll just pull it up here so you can see it. Let's see, and it's right here. So that is mostly for the background information. So Dave, you said something which you also covered in your presentation here, and some other colleagues actually from various projects, but also companies put up some vision here. So this is just to share this and to highlight that the colleagues were involved. So that's it for this part, and I suggest that you go ahead, John and Sebastian, and stimulate a discussion. Maybe we have 10, 12, 13 minutes, so we can pick some topics. So back to you.
Absolutely, with great pleasure. So John, would you like to bring...
To save some time, I try to ask some questions in the chat, but yeah, I would like to follow up on one of these questions, asking Bert. And, Philips, what is, the potential of sharing data from in the GaiaX ecosystem at a cross-border level? So if you see some value proposition there, and what it takes, because we are having also new EU projects in Horizon Europe. So what it takes for a project or for an initiative to contribute to the health data space in GaiaX? Does some organization need to be member? How it works from the practical perspective, but also what is the vision for cross-border data sharing on the GaiaX ecosystem?
A very great question, and at this moment that is still not so easy to aggregate health data, personal data like health data across European borders, unfortunately, because there are quite a lot of legislative changes between the various countries. And there is actually a European Commission project, a joint action, TEDAS joint action project, which is, and also the Commission has actually investigated what are these legal differences between the member states. And there are quite some. There's a very thick report about what these are. So Gaia X will not resolve those legal differences that today exist. That will need political action to make those more harmonized, and in the interest of the European society, to make sure that we can aggregate that data, because it is absolutely clear that from a clinical research perspective, but also from a pharmacovigilance perspective, or the way we battle a pandemic like COVID, that we absolutely, it is in our interest that we find ways to exchange data, of course, in a fully controlled manner and compliant with legislation, but we need to find a way to aggregate data more easily, aggregated and or deploy algorithms decentrally to work on that data. So I think technically, most of the solutions exist to do that in a secure and compliant manner. But left and right, there are still some legislative issues. Now, what Gaia X does and propose is a unified architecture in order to do that, because there are still many variations, and we've seen a lot of Horizon 2020 projects taking an attempt and taking a stance at combining data across borders, but it has been heroic work from each of these projects, and the results of that is not always reusable. So that's, I think, where Gaia tries to propose an architecture that would standardize the way we can exchange data in a secure manner. But on health data, there may still need to be some legislative changes to make it fully possible what we need.
But the potential, for example, if I'm a clinician, right, in the Gaia X ecosystem, if I'm trying to portray this in the future, right, I will be able to combine with data sovereignty, data assets from different providers, and maybe other innovations at the cloud level or the edge level, and build, for example, a machine learning model that helps me in diagnosis or prognosis and so on, because it's the way the information is shared and is interoperable, is standardized, and this problem is solved, right, by Gaia X.
Absolutely. So we propose a conceptual model where everything you describe is made possible. However, that is still subject to a data provider and a data consumer to have a contract between them that allows them to do that exchange of data. Now, if there is a certain law in a state or in a region that prevents you from sharing certain health-related data, Gaia is not changing that law, right? So you still need to get into a contract between parties, but the Gaia infrastructure will then, when you have that contract and that handshake that, yes, we can exchange this, this scope of data set, then we can provide you a mechanism to do that in a secure and transparent manner. And that is where the conceptual model is for.
It's clear it's a technical solution, not a policy solution, not a political solution or a policy.
It's a bit more than technical, because it also sets out the rules and the policy. So it describes a governance structure to do it, but it is still dependent on a legal contract, a legal basis under which you should be allowed to do that, right?
And for my second question was for a project to contribute to Gaia X, a future project, right? A future research project like, Horizon Europe project. What's the best and practical way to have a member or some members of the Gaia X initiative?
You do not necessarily need to become a member of the Gaia X organization. That is optional to you. And we also stimulate any party to participate. The best way is to make yourself known either to a national, we have national hubs, so then your national organization, or to the international organization. Make yourself known and participate, always having a concrete use case in mind, because we're not just developing concepts and technology for theory. We're developing this in order to enable real practical use case, valuable use cases. So yes, indeed, if there's a project with a specific value proposition or a specific problem to get solved, make yourself known to a national hub, and that is the best place where you will find similar parties like yourself searching for those common solutions.
Okay, very good. I don't know, Sebastian, if we have time for one or two more questions. I would like to ask, for example, Aristodimos, where this Healthencia product and his project stand in this debate between medical device and consumer device. We were having, you know, some fewer minutes ago, right, in the previous round of conversation. So where do you gather, what do you need to gather, you know, real world data and use, you know, for patient phenotyping and so on? Is any consumer device like Apple Watch enough, or it has to be certified as a medical device?
Well,
and so on.
Thanks, John. It's actually more a question not to us from the technical side, but towards the pharmaceutical companies and the hospitals that we work with. Usually the case is that they do need, they mainly need a CE mark. Now, whether it is also a medical device or not, they are not so much fussing about that. Our software has been certified as a medical device class 1. So Healthencia system is a medical device, and this helps them to easily adapt them in their studies. But on the other hand, we have been using Fitbit devices, Garmin devices in the studies, and these only have CE marks. In cheaper devices that we can find with excellent metrics that we can get out of them, but without CE mark, unfortunately, there we run into a problem. We cannot proceed.
So there are real projects or pilot projects that you are running with Fitbits? You know,
we are running a very real project with Fitbit. We are going to start very real projects with Garmin, but right now we are running pilot studies in European projects, but very formal ones with the Garmin. But with the Fitbit, we are currently running a very, very real study.
Okay, Aristodimos, thank you. And the other question, of course, we had was, you know, what are what is the main value proposition of 5G, right, in healthcare, where we exchange with Jerome the ideas of tactile internet, you know, mobility scenarios and so on. I was wondering, Jerome, are you aware of any pilot at a large scale on 5G and healthcare in Europe? I mean, I know we've got in other areas like, you know, transport, driving, and so on, but what's going on in healthcare? Are you aware of any large-scale system?
Well, I would have to, thanks, I would have to check. I mean, Intel IoT is a large European project with healthcare as a use case, so our project is one. But if we want to really have something larger with really
I mean,
real...
something initiated from telcos, you know, where they have
the I would have to check.
Like we have in driving, right? Like we have in autonomous driving, something like that.
I mean, in the European project I've been following or being involved, health has been always one of the use cases, never the use case. So I would have to double check if there is one project that actually aims everything to that, which would be good, because at the end, given the challenges we are facing today, it would be good. It would be interesting to just bet on one, and it's huge what we have to solve. So, but I would have to check.
If I can build on that, we absolutely believe there will be enormously strong applications in healthcare when 5G is fully enabled in there, because we believe that there will be many opportunities for body wearable sensors. And we develop some ourselves. There's many parties developing these body sensors. And in order to monitor disease progression or treatment effectiveness, we believe that will become very common, and we will be able to send patients home much faster, so reduce hospital length of stay, if we can really count on continuous monitoring in the home setting. But also these people will want to go back to work, want to be active. So wherever they go, you want to measure them for a certain moment of time with sufficient performance and reliability. So that's where 5G absolutely has a lot of potential, and everybody is like waiting for the moment where we can really experiment at scale with that.
Yeah, I was wondering whether because you know, the Eurocom has an open 5G platform called Open Interface, and one of the challenges we already faced every time we were trying to address sensors was the availability of the sensors. So getting a UE, it's 5G UE, it's tough, but it can be done. Getting a 5G sensor, or even the narrowband IoT, or even the next NR red cap. This is always difficult to be able to get access, and there is so much. I mean, if one thing that would be nice is if now we go to these body sensors, it would be nice to think in data homogeneity instead of silos, because otherwise we're going to do the same mistake again. And okay,
isn't iPhone 12 5G enabled, or?
Yeah, that's great. But you know, it's like sensors. We always have this generalization of sensors, massive sensoric access, and people were always saying, "Oh, we have narrowband IoT, we have LTE Cat."
Yeah, so
great, but
we need it. Yeah.
The problem is now even in the personal sensoric systems, now there is so much competition with LoRaWAN and others, that at the end it's difficult to see if it's going to really work in the narrowband IoT and Cat-M. It's really a stakeholder challenge. It's like someone has to invest massively and build these sensors. Otherwise, on the 5G side, people would say, yeah, well, you know, we can develop it, but we have other urgent things like autonomous driving or like connected robotics. So it's kind of a mouse and cat thing, you know.
Thank you very much to all of you. I think it's a very...
Sebastian, I think the floor is yours.
Thank you for your
taking some time, but it was interesting discussion.
Absolutely. Thank you for your interaction. Let's keep the remaining minutes. We still have 6 minutes to give the floor to Martin and Rolf for our conclusion. Clearly, we see there are a certain number of common challenges which have been identified by the different speakers. Martin, if you want to take the floor is yours. And then we'll give the floor to Rolf for the closing remarks.
Thank you very much, Sebastian, also for taking us so timely through the discussion here, and thanks to all the colleagues as well. Yes, so just to finish up here, it's clear, of course, that we have to understand when these different instruments actually work. So we are talking a lot here in the context of Horizon Europe, but we also know that, well, it takes some time before we come from the innovation. John, you put persistent pressure on the colleagues to indicate, so what level of maturity are the projects or actions that are happening. So it's of course something to be very mindful of, and something we can also see as being addressed very, very specifically in the upcoming program. So we have the Horizon Europe, which is research and innovation, and then we have the deployment actually oriented programs such as Digital Europe. There are others, and of course there's the recovery and resilience facility now very dominantly, and then we have the market with the structural funds and so on, but certainly, I mean, the normal market initiative. So just to bring that really, I think, as a backdrop to much of what we talked about. And one thing is, of course, the technologies, which of course is very much in scope here, but it was also mentioned by several of the colleagues in the interventions that bringing the regulation up to speed, and we hear how Gaia-X is also an attempt to try to give it an overarching architecture for something which is a European competence, the digital single market and the single market. I'm sure you're all familiar with the so-called European Interoperability framework, because of course it's not the first time that you know, it has been discussed. So how do we create interoperability here? And for those who are following that particular stream, which is also on a legislative train, and I think very much encompassing the concerns that are here in the health and care space. So you can see this is the specific update relating to, you could say, the local level where people live, where there's local authorities, and of course there's stacks of both technology and governance around that, governments even. So there's technical, semantic, organizational, legal, and cultural, which is a new thing introduced. But you can also see how this T-shape comes, not just, of course, in the healthcare and well-being segment. It's everywhere, right? So we have to find a way where we create this minimal interoperability, which is minimal, yes, but sufficient to cut across different also preferences. Yes, so there are still political decisions being made. So just to give a very concrete example here, this is happening not just in this sector, but in all sectors, and it's becoming increasingly, a strain that we need to fight. And of course, this is just one example how Europe is addressing this. And it would be great to see how initiatives like Gaia X, but also the actors around the networks and so on, can really contribute to bringing us together. This will not be done by the standardization organizations on our behalf. Maybe we can bring it there later, but it will not be solved on that. It's really something that we see as research, innovation, deployment, feedback loops informing both sides of the market, so supply and demand, as well as the regulators. So with that, Rolf, I think I will leave the floor to you to share some final remarks or final reflections here. Thanks for co-hosting this. Next for us, for the NGIoT perspective, just to say, well, we collect this and we bring it forward in a report format, a white paper, and then eventually in the roadmap. Yes, so Rolf, you have the floor.
Yes, thanks, Martin. Thanks, Sebastian, for moderating the workshop. Thanks for all the speakers. It was a very rich workshop, very lot of content, a lot of facts, figures, interesting scenarios, real things, solutions. Generally speaking, because I was coordinating the IoT pilots across different sectors, and indeed the health and care was always one of the most complex ones. But the pandemic has shown it's also one of the most relevant ones. So there is an urgency to act and to deploy the solutions. I think technology is ready, and we have a lot of building blocks. We have a lot of puzzles. The question is how to bring the different puzzles together in this complex optimization space. The pandemic has shown an incredible increase of attention to sort of health issues and related apps for scanning the movement, registration in restaurants, a health record or health pass for vaccination or whatever, which might trigger a lot of private investments also to the sector and to the applications. But still, as you pointed out, at the first place, it's still, the fragmentation of data, the different access to the data, sharing of data, the data governance, the Gaia X initiative you've seen, targeting a federated data framework across different cloud services, the initiative from W3C on a sentient web. How could I sort of capitalize and structure this data space and get access to the data, categorize the data, distinguish between machine data, human-centered data, and specifically how somehow illustrate the context. So all that is very relevant, and in the context of IoT and edge computing. Yes, the COVID-19 is a transformation catalyst on the one hand. Secondly, there are opportunities in the sector for decentralized health and remote monitoring, of an emerging disease, of spreading a disease, or of continuous or chronic disease, or remote medicine for recovery. So there's huge potential from the application point of view. From the technical point of view and the IoT perspective, that's my personal take. I would say, well, there are a lot of challenges which have to build on the paradigm shift from cloud to edge. And I mentioned the orchestration between cloud and edge, which is on a technology level. But we also have to deal with the orchestration between medical data, consumer data from devices, from the off-the-shelf devices, and care data, which are quite in silos. We have to orchestrate between lifestyle and clinical data, between home data space, personal data space, and really hospital. So I think then, of course, this orchestration cannot only be solved by technical issues, but it's sort of we're looking for these platforms who can orchestrate these different services, which we have to find the right business models for that one. But again, the orchestration is a key part of IoT and edge computing. And we don't know whether it's only technology, which are the technologies who bring different data across the different wearable devices and bring them to merge them together, avoid silos of data, bridging silos of data, bring device interactions at the source where the data is generated, and how the orchestration will look like. I think we have seen some ideas about 5G and other solutions. We heard also some, not today, but in other workshops, about a guardian angel, really to manage your personal data, as a personal gateway, in order to achieve that trustworthiness and interoperability. There's no silver bullet at the moment at the horizon, but I think there's an opportunity, particularly, that in the future health applications will be higher on the attention on the horizon, and that we find solution of that. And we hoped to get some new ideas and to bring up some solutions, which make it to sort of a scalable deployment, which manage that orchestration, as I said, between edge, cloud, and IoT, building on a new innovation on IoT devices, and bringing some a new way of governance scale for data, devices, and medical devices and personal devices. Thanks so much for all of your inspiring talks, for your ideas, for sharing your ideas, for the discussion, and for the organizers. And that's all for my part. Back to you, Martin.
Thank you, Rolf. I just have to thank the team. Thanks all the speakers and the audience, as well as the co-organizers here. Thank you very much. We put the stuff on the event website, and we continue. And please stay tuned. Thank you so much.
Thank you.
Bye.
Good day.
Thank you. Goodbye.
Thank you.
Bye.